So, good morning, ladies and gentlemen. I am Dr. Chandrasekhar Guru, sports medicine physician. I did my MD sports medicine from the prestigious Armed Forces Medical College, Pune. I warmly welcome you all for the Sunday's mega event hosted by the Indian Society of Sports and Exercise Medicine, the ISSEM Webinar 2021 on Sports Medicine Doctors' Perspective on Major Sporting Events. This is a series of 6 senior sports medicine physicians from our country sharing their experiences with us. It is a Sunday brunch time. Grab your snacks, fill your stomach so that you're all ears to listen to our speakers for the next 4 hours, and I shall slide and glide you all through these sessions. As we all are aware, the French aristocrat and the educator, Baron Pierre de Coubertin, launched the modern Olympic movement in 1894. The philosophy of the founder was that the struggle was more important than the triumph, that it wasn't about winning and losing, but about playing the game. This Tokyo Olympics, which has been delayed by more than a year because of COVID-19 pandemic, finally has begun on 23rd July Friday under a strict COVID protocol, including a ban on spectators. The conduct of this massive sporting event this year was possible only because of the unflinching resilience and the obstacles the athletes have overcome despite these unprecedented times. This has been well acknowledged and celebrated by the International Olympic Committee with a new Olympic motto in more than 100 years, namely Citius, Altius, Fortius, Communiter in Latin. This means we can only go faster, we can only aim higher, and we can only become stronger by standing together in solidarity, showcasing the power of sport unifying people across the globe. It is also an important milestone in the history of Indian sports because we have sent our largest contingent of 228 members, including 127 athletes, participating in as much as 18 games, comprising of about 85 Olympic medal events. It is very heartening that we have opened our medal tally with a silver in women weightlifting event. Thanks to Ms. Mirabai Chanu and the entire team. You made us proud. We from ISSEM wish the Indian contingent and the players all the very best in the Tokyo Olympics, and we request all of you as well to cheer for India. Traveling as a team physician with the team is not only a challenge in itself, but also requires immaculate planning to attend for any kind of catastrophe. Thus, we at ISSEM felt that what could be a better timing to conduct a webinar with our own senior sports medicine physicians sharing their experiences for the better interest and benefit of the younger budding fraternity. We were fortunate to have 6 of our seniors accepting our invitation despite their busy schedules and readily agreed to educate us on various nuances one has to follow while traveling as a team physician with a team for a major sporting event. Who can tell us the importance of a physician accompanying the team better than an athlete himself? Yes, we have our special guest with us, Mr. Raman Vijayan, a renowned footballer from our country. I would like to extend a warm welcome to Mr. Raman Vijayan as a special guest to this webinar today. Welcome, sir.
Thank you. Thank you so much.
I feel immense pride in introducing Mr. Raman Vijayan to you all. Born in a village named Kandaramanikam in Sivagangai district of Tamil Nadu, Raman Vijayan rose to become a renowned footballer for the country in an international circuit. Professionally, he had played for India's top clubs in East Bengal FC, FC Cochin, Tempo SC Goa, and Mohammedan Sporting Club. Raman Vijayan is one of the 2 Indian footballers, other than Baichung Bhutia, to be the top scorers in the National Football League, a remarkable feat that finds a place in Limca Guinness Book of Records. Raman Vijayan was fondly nicknamed as the Golden Boy for his expertise at scoring winners in crucial games. With an aim to identify and nurture the talented footballers from rural parts of Tamil Nadu, he has started the Noble Football Academy in 2009. He is also the founder of a professional football academy named Raman Vijayan Soccer School in 2016. We are really proud to have you as a special guest today, sir. Now I would like to invite Mr. Raman Vijayan to share his thoughts on the webinar today. Over to you, sir.
Thank you. Good morning to one and all. First of all, I like to thank ISSEM for inviting me such a wonderful program. It's been a great honor to be part of this event. It's highly privileged to meet the sports specialized people like you all. I'm especially Dr. Dobson for inviting this program, and it's a really honor. And the same time, I always believe that without you, people, our sport cannot be taken to the higher level. Any sport in our country. Since 1985, I involving with a particular sport. Football till now. I had a great opportunity to meet doctors, physios, masseuse, and nutritionists in various levels. Um, when I was studying in a sports hostel in 1985 in Madurai, hardly we never know that what kind of injury it had, but only the brufen was the only medicine who a savior for our entire sports people. And later we realized that okay, some magic oils who are recommended in nearest places who cure our injuries. And when you reach in your college, then you will come to know, okay, once you get injured, you will apply ice. So these are the levels we start crossing. And once I reached Indian Bank in Chennai, I had an opportunity to meet doctors. uh, so what I when I joined professional footballer in East Bengal 1996. I think some of y'all must be from Bengal. I don't know, but when I we had an opportunity to meet all the sports specialized doctors, where who can identify injuries. You can exactly he can explain about your what kind of injury it is. But many areas, many times we fail to meet sports specialized people. Till now we are lacking to on sports medicine people. I don't know whether we never had an opportunity to even played for a country, even played for a top clubs. Maybe the clubs or our country, our SOI or SDA team, um, they don't bothered much on bringing sports science people or sports specialized people for the sport. That's what I always feel like, because during our time we always had an general doctors who treat all the injuries, who so whatever he has knowledge, so he tried to cure your injuries. But later stages I really felt that this is the area where our country requires more people to be involved in, especially on a grassroots, on youth development or academies. That's what I feel, because I'm very fortunate, had a worked in different areas, where when I was a player in a professional clubs, then later I become a coach. I worked in ISL and I leagues. I travel many countries, but even though what I've found, that still our country is lacking in this area. um, Maybe how many people will agree with that, but for me, when I was a player, I had a two crucial injuries I faced. One was my quadricep injury when the 2002 or 3, I think. And that time, maybe one of the physio who doesn't know much about that, he made me to massage. And my career, like it took me 3 months to come back to the field. This is one of the example I'm telling you, because these days when you say it'll be easy for people to know. And later on I got a crucial axial ligament, and uh, where I could have done surgery immediately. But the one of the doctor advised me to, you can get back to the field 1 month with the right rehab. But it took me 4.5 months to come back for a proper thing. These are the areas we really suffer when our days. Now at least when in the professional clubs are start finding the right people to right thing to bring the best facilities for the players. That's one good thing which happening, because I worked in ISL for 2 seasons. We had an opportunity to meet specialized people like you. uh, but I always feel that still there is much lacking in a sports scientist people for everyone, for the most people, for most needy people. That's what I always feel. And I always realize when I become a coach, I first thing I start finding people, you know to 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 identify my players before my players get injured, how to prevent them from the injuries. That's what I always find. Thanks to Savita hospitals, who Dobson and other people who are really helping us for past few years, for youth development programs and other thing, the individual assessment as well as. But this thing is required for every academies, every youth development, every grassroots development. So only in our country, only top class professional who can afford to go to the sports specialized people, or sports medicine, or specialized people who can uh, get in touch with. But I really feel bad that still our sport can be go to the better place if you people could come and help these kids. So most of the time I always feel that when I travel to uh, recently England for pre-season training with Delhi Dynamos. The facilities which we had, we trained with West Bromwich Albion. There is a club called West Bromwich Albion who plays in Premiership. So the academy, they stays in 11th or 12th position in the Premiership, but the facility which they are having in their academy is unbelievable. The main teams train there, and the entire facilities, I start you know every day I go, every day what all the things are there, I start watching everything. And I felt we are far behind them. That's the feeling I had when I was there. And but but when you come here, we have the best doctors in our country, we have the best facilities in our country. But why it's not reaching in the right places? That's the question I always remind me. And this is a unfortunate thing that whenever the big games comes, the Olympics or Asian Games or World Cups or Euro, we always have start questioning how many medals we are going to get, how many trophies we are going to get. But are we ready for that? Before are we ready? Are we prepared for our sports persons with the right kind of on a training program or a support? uh, I feel is it no. But the general people always think that okay, why our country is not performing. But the but this is the biggest issue for our country. I always feel that as a sports person, I've been handling for academy kids, youth development, and the I League and ISL players. Uh, the core thing is essential from people like you guys. It's always I feel, but it's highly privileged. I always wanted to the best thing to be done for my players. I always search for the people who are really expertise for these kind of injury and rehab systems. Apart from that, the nutrition also is a major role for our sports personalities. When they grow up, they get proper nutrition diets and everything. But when they are starting up, is coming from the rural villages, coming from the poor backgrounds, are they getting the proper nutrition? No. So when I join in a club like ISL, I start finding, oh, okay, these are the food we should have. these are the food is healthy, these are the food to really important for the sports person. And but now for my effort, for my try, I start finding those things. But whenever you meet a nutrition, they bring up with a big chart of the people who can't afford all people can't afford. So these are the reality which you should understand. And I think you are the best person to be a part of a sports fraternity. Definitely you people will help us to bring our nation into the next level. That's what we always believe. And this is very highly privileged to be part of this. This is the reality which I like to share with you all. But even when we travel in national teams, we had similar issues. Even in we don't know why we are not performing. When you go and ask someone, they don't have a proper thing for you, because they don't assess you, or they don't give you a proper plan for you. In those days, whatever we had, we have to come up with the best. If you fail, you fail. If you success, if you are success. But there is no proper things to be carry, and there is no proper schedule to be carry to our entire life. When you compare to the international European athletes, we are very much lacking. But even though we had expertise like you, and the facilities are not we are equally good to have facilities in other countries. But even though we are lacking in this area, but I pray, I wish you people should help the Indian sport to be come up with the best level. Thank you for the wonderful opportunity. Thank you so much. I love to listen from you all. I definitely stay as long as I can. Thank you so much, ISSEM. Thank you.
So Raman, that was really wonderful having you here. Once again, we would like to place on records our gratitude from the ISSEM team for honoring the event. And we sincerely wish you and your noble vision for betterment of the sports all the very best in all the endeavors.
Thank you. Thank you so much.
Thank you. We have a question from one of our audience. This is Dr. Gagan Kumar Banodhe. He has just asked us if you could answer, manage without doctors in your playing days.
Can you come back again?
Yeah, the question is, how did you manage without doctors in your playing days?
Yes, there is no option for us actually. So whether you have a good doctor or not, you are there. You are the best person who can, because those days there is no excuse, there is no replacement. You have to perform. If you don't perform, they will throw you out. Then someone will come. So to catch that place, whether you have an injury, you have to hide it and play. That's the only thing. Now the people get injured, they have kind of a treatment which they are having. Those days we are less numbers, and the people trust you. And even though if you are having an injury, you have to carry. But the doctors were there, especially in Bengal. There are sports knowledgeable doctors were there. And definitely from those doctors we start taking helps, and we start performing, even though they're not available for all the time. That's a problem. When you get major injury, only you can go and meet them. If you have a small injuries, that also matters for you. But every day's training programs, and no doctor will be there. Only when you get major injuries, you will have to have a doctor to meet. So these are the difficult time definitely we had. But now the things are changed, and we are in a better place now.
Thank you so much, Mr. Raman.
Thank you.
And before starting with the actual webinar proceeding, I'd like to invite our president of the Indian Society of Sports and Exercise Medicine, Dr. Hanjabam Barun Sharma. Dr. Hanjabam Barun Sharma is currently the president of the Indian Society of Sports and Exercise Medicine, ISSEM, is hosting this webinar, which is the only national level registered APEX society by recognized specialists in the field of sports and exercise medicine in the country. Speaking about Dr. Hanjabam, He is a sports and exercise medicine specialist as well as a medical and clinical physiologist. After finishing his MBBS, he completed post-graduation in sports medicine from Netaji Subhash National Institute of Sports, Patiala, as well as in medical physiology. He has worked as sports medicine specialist in Sports Authority of India, NERC, Imphal, and with various sporting teams and athletes. He has completed senior residency from the famous MAMC New Delhi as well as from AIMS New Delhi. Dr. Barun is currently the faculty in charge of Sports Exercise Medicine and Sciences section of the Human Performance, Environmental and Lifestyle Medicine Lab under Department of Physiology at Institute of Medical Sciences, BHU Varanasi. He is also a martial art practitioner, mind you, and a black belt holder from the World Taekwondo Federation, and also a Tanka enthusiast. He has numerous national and international publications to his credit and is also an active reviewer as well as in the editorial board of few prominent. Work on an isometric exercise device is on the process of registration for patent, and he has recently been conferred Devraj Bajaj Research Award 2021 by the Association of Physiologists and Pharmacologists of India. I would now like to invite him to say a few words before we commence with the proceedings of the day. Over to you, Dr. Hanjabam.
Okay, thank you very much. I hope I am audible. Thank you, Dr. Guru, for such a wonderful introduction, as well as Mr. Raman. Have aptly highlighted all the point which athlete face on ground, because ground level is important. All the scientific stuff among discussing among sports scientists or sports doctors is not enough. We have to apply on the ground. So once again, I thank you all. The speaker are very much senior, experience, and they have been accompanied to various international sporting events, as well as they have treated lots of elite players also. So I think all the participants, as well as the newly passed out sports medicine doctors, they will gain tremendously from the experience from our speakers. And I also welcome all the participants here with us, and also the participants who are watching right now on YouTube. And since ISSEM is right now it's a relatively new society, but it's a society of the specialist sports and exercise medicine in the country. That is what's important. And the most important thing is, sports medicine as a specialty has, it's evolving, and it's coming up with a tremendous, the potential, as well as especially for India, where we have large number of the population, but unfortunately, the medal tally is a little bit lower on the lower side. But the things are changing. With recently, yesterday with Mirabai Chanu winning the silver, so it's a good start for us. And as a sports medicine doctor, we in this webinar we want to touch what the special, special touch that a sports medicine physician can give in relation with the international sporting event like Olympics and all that stuff. We have been hearing that lots of doctors has been going to international Olympics and all that stuff. Most important is I want to the institution that sports medicine doctors, specialized sports medicine doctors are here now, and with changing time, because sports medicine doctor, because we are the doctor who have done specialized and highly specialized study in sports medicine, and the team physician as well as the traveling with the team is a subspecialty of the sports medicine, where a unique contribution, unique specialized evidence contribution can be given by a sports medicine doctor. Sports medicine doctor has to understand all the team dynamics, as well as he has to, or he or she has to act as a, not only act as a the personal physician of the particular athlete, but also as a team. He has to know the team dynamic. What is the importance? Performance is important, or a particular health of an individual is important. Sometimes the conflicting issue is there in the practice, day-to-day practice of the sports medicine, which is not there in case of a normal clinician. And also knowing all the concept of the doping and the latest scientific advances in the field of the sports sciences as well as the sports medicine. Sports medicine doctor can offer tremendous in the field of the sports performance science, as well as helping our country to be on the top level in the international, sporting events. So I once again thank with all our team, the webinar team, who have actively, so beautifully hosted this webinar, and I hope that many useful, latest information, scientific, practical tips will be given to all the participants. And I once again thank you, Dr. Guru, and all the speakers. And let's begin without wasting time. Go ahead.
Thank you, Dr. Hanjabam. It was nice, motivating way of starting the webinar. So now going on with the sessions, we have first session, the speaker will be speaking on my experiences as a sports physician at national and international competitions. So I would like to extend a warm welcome to Dr. Rajiv Ahuja on behalf of the ISSEM members. Very good morning to you on this wonderful day, sir.
Morning.
Sir. So before proceeding on with the session, I would like to introduce him to you. Dr. Rajiv Ahuja is a medical graduate of Maulana Azad Medical College, New Delhi. He taught the second batch of diploma in sports medicine at the Netaji Subhash National Institute of Sports, Patiala, in 1988. And later, he did his master's in sports medicine from Australian Institute of Sports at Canberra, 1995. He did advanced training in sports traumatology from the famous Central Institute of Traumatology and Orthopedics, Moscow, Russia. He has also done the team physician's course of American College of Sports Medicine at Dallas, USA. He worked as medical officer with Sports Authority of India from 1988 to 2000 at Patiala, New Delhi, and Bangalore centers. During his tenure, he accompanied numerous Indian teams on the trips abroad as team doctor for hockey, boxing, weightlifting, etc. He's been the doctor of Indian men's hockey team for almost 5 years, and he's been to various international and national games as team physician. Major international events that he has been as a team physician include the 1996 weightlifting World Championship at Warsaw, 1992 Barcelona Olympic Games, 1998 Asian Games held at Bangkok, and more recently 2018 Gold Coast Commonwealth Games. He's been the doctor for Maitland Rugby League Club for almost 6 years now. Apart from his stint as a sport physician, he has also been a teacher for various courses in sports sciences. He has organized a number of courses and has been the speaker at numerous sports medicine conferences between 1988 and 2000. He has authored almost 22 research papers and has attended over 50 conferences in sports medicine and sports sciences. His interest in sports medicine stems from his childhood days in schools, where he was a keen sportsman in athletics. He was selected to represent Delhi University in swimming. He still swims and he compete for his swimming club in East Maitland, Australia, where he has broken the club record in backstroke twice in the past 10 years. With so much of vast experience in the field, we are extremely delighted and eager to listen to you, sir. We welcome you, sir, for sharing your valuable experiences with this bunch of up-and-coming audience. Over to you, sir.
Hello, I'm Rajiv, and thanks to ISSEM and Dr. Hanjabam, Barun, and Dr. Ashay Jadhav to have me on your panel for speaking today on my experiences with the various teams during my tenure in India. And from 1986, I was in sports medicine till 2000 when I moved to Australia. Now, my talk is a summary of my. I'll just put the next slide on, and I will talk about various types of competitions I've been. What are the doctors' roles in pre-competition preparation during camps and before going for the competition? what are the different roles of sports physicians during various competitions, and then how to liaise with other sports professionals, including coaches, administration, allied health, and meeting doctors from other places. And when you come back from competition, what the doctors do, and overall how to meet when we meet people, how to interact, So basically, this presentation is focused at a role of a doctor towards national, international competitions. My tenure was around 12 years, so it's a bit 12 years. I've been with a lot of teams and done a lot of work with different roles. So I'll go one by one and see if I can talk about things in the limited time of half an hour, which is given. I'll always love to answer questions, and if you want, on the right side of your screen, you can put a chat on the questions. So what is my experience with sports teams? Been to mostly as a doctor or an organizer or a planner for sports clinics when in hockey, weightlifting, boxing, judo, swimming. I've been to Olympics and Asian Games, Commonwealth Games, and World Championship and South Asian Federation Games. So that's my background, and this is a limited one. I had more of these. These are the team for the 1991 Europe tour when I was team doctor for hockey. And as you can see, this is the coaches and the captain and other players like Raj and Mukesh Kumar and all these people. Olympics 1992 Barcelona, where we were, Burgat was the captain and Balal and other players are here. I'm just over here. World Weightlifting Championship, Warsaw in Poland. This is Karnam Malleshwari, as you all know, our coach Sandhu, and our secretary of the federation, Kunju Rani Devi. All these players. So one month training camp come Brandenburg Cup boxing for junior boxing team. That's ISSEM in Shivsing. These are all. This is in Cottbus, Germany, where we stayed for around 2 weeks, and then we had a week or two of competition, including in Cottbus and in Berlin. And women's hockey team, Asian Games again, and this is 1998. Mr. Bangu is the coach, and there's another coach. So this we won the medal. Now 2000. This is till the previous slide. I was in India, and then I moved to Australia, and then recently, around 3 years ago, I was working at the polyclinic in the Games Village at Gold Coast, and this is the medical team. These are all doctors, physiotherapists, X-ray technician, ultrasound, masseurs, and admin staff who were in the team. And this is Dr. Anita, Anita King is. She was the overall in charge of the medical center in the polyclinic in the Games Village, where I was working for a couple of weeks during Commonwealth Games. Now, within India, we had a lot of competitions. When I was posted at New Delhi, Calcutta, I went for and the 3 national games which I attended were Pune, Bangalore, and Imphal, and in different roles. When I was in Delhi, I was with Sports Authority of India at Jawaharlal Nehru Stadium, and then I was doctor for the Delhi contingent. And when I was in Bangalore in 1999, I was doctor for Karnataka contingent to Imphal. And whereas in Bangalore, when we were there, we organized the national games in Bangalore, and I was in charge of the village polyclinic or medical center as a nodal officer. And I'll explain to you what the nodal officers are later on. And That is the. Now, this is one rare occasion when we had to do a medical assessment of the Indian cricket team with Sachin and Sandeep Patil, Ravi Shastri. This is Ali Rani, the physio. So we did it, and then Dr. Khanna from Sai. So these are all, we conducted a 3-day complete medical and physiological and rheumatic assessment of the cricket team. Now, pre-competition preparation. During the national games, national camps in Sports Authority of India, the players, we have a medical center where the players have come and see the doctor. Sometimes they have injuries, sometimes they fall ill, sometimes they need physiotherapy, some sauna, massage. These facilities are all provided at Bangalore centers, Nehru Stadium, New Delhi, and Patiala, of course, is the National Institute of Sports. So when we are in a camp, what do? It's not just a passive job sitting there and managing players who come and discuss with you about their injuries and all. Continuous, all the time we have to do medical assessments along. Sometimes we do field tests with sports physiologists, and we take help of anthropometry experts, biomechanists, advise the teams about nutrition. This in Sports Authority of India, there's a nutritionist as well who guides the players about the managing the training, diet during training. In some cases, the role of carbohydrate loading before competition, fluid intake, optimal fluid intake. What is the ratio of protein, cholesterol, protein, fat, and carbohydrate, vitamins, minerals, what diet to be given to which sports person. Now it's very specialized. And when I was there between 88 to 2000, we had to go and do it ourselves like doctors. And sitting with the coaches and planning about the optimization of training. Now, first, my experience with Indian hockey team, we used to do basal body pulse rates. In the morning, before they used to get up from the bed, they used to leave the doors open. I used to go at around 5 o'clock, check each and every pulse for around half an hour for all the players. And the resting pulse rate, now they're saying that it is a very important parameter to check whether they're going into overtraining. So if the heart rate is fine. There are other reasons also for the heart rate to go up. But then one of those things that we used to, and talk to the coach about planning of the training, the load, whether it's aerobic load, anaerobic weight training, what type of load there. Then during the when they take part in sport, and that time we had these monitors, which are now very common. And that time these polar monitors used to be put a strap around the chest, and you note the heart rate, and you can monitor the heart rate during the whole of the 35 minutes or 40 minutes of the training, and later on analyze how much you went into aerobic or anaerobic zones, and then what is based on the lab tests with checking lactate threshold. We can optimize the lactate level with the heart rate and advise the coaches accordingly. The physiologists did a lot of job work in this field. Injury prevention itself and management, training the right muscles, stretching, strengthening, coordination, flexibility, all the parameters of GTMT, what we used to do, we used to try to manage. Dope testing before competition, of course, no country wants that people to be taking drugs, and they need the teams to be drug-free. So it's very important. Sports Authority of India used to conduct. I've been to LFP, Bangalore, Patiala, various places, wherever there's competition, even Cochin, South India. Before a competition, we prepare our own doctor's bag, and that time we are not only taking medication, splints, ice packs, sprays. I used to also carry with myself, in my bag, an ultrasound machine for physiotherapy, and TENS machines, therabands, and any other physiotherapy equipment. Because at that time, we ourselves used to do even massage and even physio, even treating the injury, treating illnesses. There's a one person's job as a complete management of all the parameters which the coach doesn't have to bother about. Just coach gets a feedback from the teams. But that was our role. So general medical checkup, orthopedic evaluation, field tests with the physiologist, and this is our Charles, with our hockey previous coach, been there. Boxing, this is before Brandenburg Cup, we were checking their aerobic capacities. And so before competition, how to once you are selected as a team physician for a team, which involves your passion in sports, and it is observed by the coaches here, Balkishan Singh, there's Katare, and there's Sandhu, weightlifting, Sandhu, and these they observe you. So it's very important for you to be very, very focused. And I used to devote a lot of time, say, starting from 5 o'clock in the morning, going to the rooms, then going to the training ground at the morning session between 6 and 8:30, then check, have breakfast with them, see everything, everyone's in a good mood, and then go to your own clinic, manage their medical problem, check their psychology, one day nutrition, another day rehabilitation, physio, sauna, spa, massage, all these things. And then in the evening, again, go to the training session, and afterward, meet them at dinner. So it's a whole day job. It's just not if you're just involved with one team. During competition, the doctor can be just a team doctor, where the doctor is with one team, like in hockey or boxing or wherever, and you are devoting your time towards one team. So in this case, this is the hockey team, Shakil, Dev, the team, Thirumal, in the Asian Games, they had a fracture. So during the competition, the doctor has to be ensure that the players are injury-free and treat them well, provide other things like fluid intake, nutrition intake. And there is another role of a doctor, apart from a team doctor, the competition doctor. And a competition doctor, like when you posted, like in Sports Authority of India in New Delhi or Bangalore, there's a lot of competitions going on, like the international Indian Amateur Athletic Federation have national, international competitions, gymnastic federation, judo. They all have national and international. And we provide the medical cover. So I remember an instance when we provided medical cover for cricket matches and all the game, all the tournaments, even in Shivaji Stadium hockey, we used to provide medical cover. And not only at the ground, but post competition and post game medical cover. We liaise with the management. So here, in boxing especially, you are a team doctor, a doctor with a ringside, and also you manage the whole. And sometimes you have to call the technical decision to stop the bout if you feel that there's a concussion or something going on. As a contingent doctor, you manage multi-sport events, like this one's Olympic Games in Barcelona, and you have myself and Dr. Chen were there, and there's another doctor who was there. And in Asian Games in Bangkok, we had Dr. Sarla with us as well, and Dr. Bharatia Singh, Dr. Rakesh from athletics, and he and me were the contingent doctors, and I was also with hockey, men hockey and women hockey both in that games. Whereas we had a physiotherapist, I think maybe for the second or third time in life, that we had a physio along with us. And we used to plan the medical cover for like 8 or 10 different sports. And we had a room or a medical center where we had a physio setup, a massage setup, and we had our consulting room, our own setup. So we used to, one doctor used to stay in that room the whole day, and the other doctor used to go with the teams to different games and provide the cover there. Another role of a doctor is a doctor for a village polyclinic, or you can say a doctor for who manages the medical cover at the competition games village. In this case, Delhi State, they came to the village in national games. And this one, when we had national games in Bangalore, they organized, the medical cover was provided by the municipal corporation doctors of Bangalore from various hospitals, but there were 4 nodal officers, and all of them were from Sports Authority of India. Dr. P.K. Ramel, Dr. Sarla, and Dr. C.R.K. Murthy came from CRPF. And I was in charge of the polyclinic or the village medical center. And there were 10,000 sports persons living in that medical center. We had round-the-clock medical cover with 24 doctors and numerous nurses. We had physiotherapists. We had ice cube arrangement machine. We have medication arrangement. We have arrangement for. But some of the states had brought their own doctors. So we all got together, and all of our 4 of our nodal officers were provided with this walkie-talkie where we could communicate. Even we had a chief, the health secretary of the Karnataka government. Just anything we needed anytime, and that was our role. And this work is really taxing. So we used to work from 5 in the morning till 1 a.m. and hardly 5-6 hours sleep. Unfortunately, there was a death there, and that was a chef in the kitchen. So we just had to manage that as well. It's not only the sports person, you manage the officials, you manage the personnel who are working, everyone. We had ambulance around the clock, and that was a big job, managing the whole 10,000 village players in the national games. When you go abroad, you have many problems happening with players. Sometimes players can get operated as well. In this case, there's appendix operation. So you have to be on the ball to diagnose things. A boxer had jaundice, hepatitis A, and had to be admitted in hospital. Another player had severe injuries. Deputy Chef de Mission Delhi had some medical problems, and he had to be admitted to hospital. So you have to be available for not only the players, but the officials as well. And this is the Imphal in Manipur. Once you are working in this field, you have to liaise with all the different important people who manage players, manage sports. Mr. Bhagwat, wrestling, Satpal, these are coaches, boxing, coaches, Shiv Singh, Mr. Singh, hockey coach, Bhaskar. So we used to be in very, very close touch. Every day we are liaising with them and talking to them. Balkishan Singh, MP Ganesh, Zafar Iqbal, so Romeo, James. So these are the coaches, and Mr. Bandari is badminton. So we used to have very, very close liaison, and practically every day during the training camp and competition, you are together, you're eating together, you're talking together, you're traveling together in the bus. You are talking about each and every player, completely focused towards them. Also, you have to liaise with Federation or Olympic Association people. Mr. Ashwini Kumar, Vice President IOC, and he's the Lieutenant Governor of Delhi that time. And we had Suresh Kalmadi, President of IOA, Shivanti Adityan, President IOA, and he's the principal of a physical education college. Randir Singh, Secretary IOA. So these people used to talk to you, and we used to go and tell them everything. During a competition, when you are managing a team, they will come and they will encourage you, and they will talk to you, and whatever facilities you require, they will try to ensure that you get it from Federation, Association. I've had a privilege of working with many sports physicians, both from India, this is from the Olympics, Asian Games, and this is one of the hockey tournaments. This is a doctor from Malaysia. So we used to work in Germany. This is Prince Alexander de Merode. He's President of Medical Commission of International Olympic Committee. So that when you go to Olympics, you try to meet all these people, and this is in charge of the dope control of one of the world championships, and he was in charge of dope control of Barcelona. Pradeep Gupta was in charge of control New Delhi lab, and all these people, because you have to liaise with them for the players. And once that all the competition finished, what then? All the players are tired, and some are happy because they won, some are not happy. You have to manage all the emotions as well with the federation, with the coaches, and you have to document what medical problems happen for records for the purpose. Celebrate your wins, and that is many times. Some parties happen, and then some monetary rewards and cash rewards are given. Sometimes they lose, and then we sit down with the federation, coaches, everyone, talk about it and what's happened. Players who got injured or got ill during the competition, you have to plan their rehabilitation and recovery, and they should not go home and just not bother, forget about what they have to do for their. There might be a fracture, there might be a sprain, there might be an illness. You have to give them a proper advice so that the next time they come, they're prepared for the. So then you reflect on team performance, area of improvement, give your feedback to Sports Authority of India, Department of Youth Affairs and Sports. Fortunately, I was working with Sports Authority of India, so I could liaise and get in touch with all the administration people, executive directors, director general, even ministers. Then you document everything. Oh, once you go to different games, you have a great opportunity to meet a lot of people. This is the Italian women basketball team at the Barcelona opening ceremony. Carl Lewis, you just bump into big sports persons, and who are well known. Each one for gold medals. So you just meet them and you get inspired from them, and you talk to them, and they encourage you as well. Terry Walsh, hockey coach for Australia now, Indian team. This is president of World Weightlifting Championship. Pranamajit Chanul is one of the. Mukul Vasnik was sports minister at that time, and DG Sai was Jatni, and then we used to meet. And whenever a team goes abroad, come back, you come and meet them, and they talk to. He was very instrumental helping me out to go to Australia for my master's degree in sports medicine in Canberra, 1995, and he encouraged me all the time. Farooq Abdullah, he was the Sheikh, he was the, I think, Chief Minister of Jammu Kashmir. At that time, we had a camp in Jammu before the Spain tour. And that camp was specially planned for Jammu because the time we were going to Spain, it was winter. And the temperature would have been 2 or 3 degrees there. And so we planned the camp in the same atmosphere what the player will be going to Spain. That's what we thought. And we talked to KPS Gill, the president that time, Jyoti Kumar, secretary. And we talked, and this is Mr. Kumar Bhaskar, and we all sat down and said, and we planned the kit, what type of kit the players should wear, warm kit to keep them warm, what type of fluids they should have, what is the environment in Spain, Madrid, Belgium, Spain tour we had, and we had a camp in the cold environment. We also had sometimes a camp in Shilaru, which is a high altitude training center for planning for hypoxic relationships with high development of your aerobic capacity. This is the son of Lal Bahadur Shastri. There's a tournament, Lal Bahadur Shastri hockey tournament. I provided medical cover when I was in Delhi. Kapil Dev, DG Sai, is the project officer. We used to meet people. Nisha Millet was 7 times the gold medal in Imphal for swimming, and I was doctor for Karnataka team. Satpal, gold medalist in 82 Asian Games. Bhagwat sir, Dronacharya, first Dronacharya award of India. He was wrestling coach. PT Usha, of course, everyone knows, and Ngomdir sir. So we used to meet, and quite a few times. Anupam Gulati. So you have to keep in touch with media people, and he was the one who give your feedback in the news, in the radio, in the television, and this is an umpire from England. So whenever you go and you have a day off and you talk to others and you meet around. So what happens when you come back? You have all these mementos and all these pins. Last day of Olympics, there's all intermingling of sports person and exchange of pins, and these are all memories what you have wherever you go. And fortunately, I've kept them at one side, and so I could take a photograph for. So this is what you can see behind me. I try to put it up here. That's my room at home. And I've just, all these are the mementos, and all these are the things provided to me in the Asian Games and Indian Olympic Association, Hockey Federation, Olympic Association. These are my some swimming trophies, and you can see, and all of them are small mementos what you get collected during the game. So wherever you go, doctors, physios, chef divisions, they present you with something. And I got a lot of pins and a lot of things, and all those collect over the years. So I've just put them together. So I thank all of you for listening to my talk, and especially again ISSEM. And I thank my daughter Sakshi Ahuja, who has helped me prepare this talk, because it wasn't, without her help I could not put this thing together. I thank my wife and family for giving me time to prepare for everything. And I thank Sports Authority of India, Indian Olympic Association, and all federations I worked with, including coaches, officials, and of course, Dr. Mathur, Dr. Ashoka Ahuja, who were the people who taught me in Sports Authority of India at NIS Patiala. I thank them. And thank you once again. And I hope my experiences would have been a bit more beneficial for you. I think I'm just within time, and there must be some time for questions. I would say that if there is anything you would like me to help you with, and I can do it, I will definitely come forward to do it. And I've just come back in touch with the Sports Medicine Association only since last year. There was a bit of gap in between where I never got in touch back, but now I'm happy to be talking about my experience, and I hope that whatever limited work I have done in my tenure and my innings, what you can say, I still do swimming, and this morning also I went swimming. I compete in Masters, Aussie Masters, so I'm still a keen sportsman. I'm doctor for rugby team, local club. Basically now I'm a general practitioner, but I have a special interest in sports medicine. Thank you so much. Thank you.
So much, sir. That's really an enlightening session, and it was a complete montage of your service here at Sports Authority of India. Wonderful, sir. You have taken us way back from 1988, and then it was wonderful to see all those photographs and your practice as a team doctor in the teams. And beyond that, I think you've also given us various, insights into various aspects of team doctor. Not only the professional aspect, but also the other aspect, as like you said, the listening and keeping in good touch with the coaches as well, so that you build up your rapport. It was wonderful, sir. Thanks for the wonderful tips. And now. I hope, sir, definitely the younger generation will take cues from your talk. And we have one question from one of our budding sports physician. He asked, he has messaged me, he has asked that what motivated you to choose this field, sir?
Well,
from Dr. Ashay.
Yes, Dr. Ashay, I've been in touch with him for the past few days, and it's lovely the way you planned this thing, and I'm so happy that you've done it this way. I used to do a lot of sports when I was in school, and then I got into medical school. Sometimes you have time in the morning and evening, and fortunately, I did not realize that I could win in swimming. So I used to train in swimming during summer vacation, and somehow I may be genetically biased for, and I had a little bit training as well, and I have good coaches. So in second year, I was a good swimmer, and I never knew I could swim that well. I used to swim a lot. In school, I was a keen athletics player. So when I finished school, then I went into medicine, and then once I did swimming, I represented Delhi University. I did competitive swimming, and I loved sports. After MBBS, what to do? You gave a PG entrance exam. I got entry into diploma in radiation medicine. Well, I wasn't much keen for that. So I thought, what should I do which I have a passion for? I like it. So then there was this ad come into the newspaper about diploma in sports medicine, which is organizing at Patiala at the National Institute. And I applied for it. Fortunately or unfortunately, whatever you say, all the people there were sponsored from Army, BSF, CRPF, from the medical colleges, and they all got in through. I didn't have a job that time because I'd finished my house, and I wasn't one of those people, but still I got in because of my interest. And then once I got in, then after finishing the diploma, what next for me? So fortunately, there was a job opening in Patiala, National Institute of Sports at that time. And I applied, and I was employed as a medical officer with Dr. Ashok Ahuja, Dr. Bimla Bhatia, and then I was a medical officer for National Institute of Patiala. And then I was there for 3 years, interacting with all coaches, managing diploma employed, and then it came build up. I never even realized I'll be a doctor for a team. I never even thought about that. It just came automatically as people came to know me, I came to know them. And then one day when I was posted in New Delhi, then one day the executive director teams called me and said, Mr. Balkishan Singh is having hockey camp in 1991, I was 30 years old. And then they said, Mr. Balkishan Singh wants you at Bangalore. Can you fly tomorrow? And I said, I was a bit surprised, but all that happened so fast. But I went, and then the rest is history.
Great, sir. That was nice to hear the reason behind how you joined sports medicine. So we have one more question. One question, we have time also left. So this question is from Dr. Siddharth. So yes, ask you. He says that great talk, Dr. Rajiv. A question: how different has been the sports medicine coverage from international events in the 80s and the Commonwealth Games in the 2018 that you recently covered?
Well, with all development, it's an eye-opener when you work in 2018 at a village polyclinic as to what we did even when I was in 1998 Asian Games, Bangkok, 20 years ago. Facilities have improved. There is more and more involvement of sports physiotherapists now. Even half of the medical center was physiotherapy, massage, sauna, spa, gym. So whenever the player comes, they're more interested in recovery, how to recover for the next game. So during a sports competition, there is more involvement. Now, that time, I was the masseur, I was the physio, I was the doctor, I was the one person to manage everything. And it's a big job. You carry your oils, you carry your creams, you carry your physio equipment, you carry your equipment. You investigate what is available where you can get ice, where you can get a gym, and you run around with a team when you're a team. And the team needs all that. So you provide all the facilities and you analyze the injury, manage the illness if they get admitted to hospital, manage doping. You stay back after the game with the player till the dope test is finished. It may take 2 hours, 3 hours. So it's, and the facilities in Commonwealth Games 2018, I was sports medicine doctor. There was a GP, general practitioner. There was an orthopedics doctor, and there was an emergency physician. So at any shift, I used to work 6 a.m. to 3 p.m. Then there was a shift 3 p.m. to 10 p.m. And so the clinic, at any time, there were minimum 4 specialties. Because the player, if he has a medical problem, a general practitioner can take care of that. If he has an overuse problem which is aggravated by sports or a sports injury, then the sports injury person. If he needs something like arthroscopy, urgent operation, or plating or open reduction, internal fix, whatever it is, because so many injuries happen at any stage, the orthopedic doctor takes care of it. And if he has other medical issues like asthma or exercise-induced bronchitis or whatever complication, which an emergency physician can take care of it. So, and then the facility, they had x-rays in the polyclinic, they have ultrasound, they have a visiting dentist, they have an optometrist. So when you plan things like Commonwealth Games or big events, ambulances, and the Gold Coast Hospital was just across the road, like not even 500 meters away. So that's the way they planned it. Whereas other places, they have a games village, they have a polyclinic. In the games village, there is not many facilities at that time in 1998 or some, and you had to go other places, take players for, the gym is not there, the ground is not there. During the games, inside the games village, there is no place for training for 10,000 sports persons. There's no gym like that. So you have to organize all that. And even the sports injury treatment facilities, a lot of them, you have to take care of them yourself. It's a lot of change. And I have realized that I'm happy that I could work in Gold Coast after many years, and because I was working with the rugby team here. So I would say keep involved and keep up to date with the latest information. Don't worry about things like not getting into going with the team. Don't worry, just keep working. People will notice you. People will realize that you have a passion.
Right, sir. Thank you so much, sir. Thanks for those golden words. Thanks for the wonderful session too. Moving ahead to the session, we have our next speaker ready. Speak on challenges faced by team physician in Olympics and major games. Yeah, let's welcome our next eminent sports physician, Dr. Kenjom Ngomdir, for his address on challenges faced by team physician in Olympics and major games. Thank you for being here today, sir, with us, despite your official commitments. Kenjom, I hope you are online.
Can you hear me? Am I audible?
Yes, sir, you're audible, sir.
Yeah. So please go ahead. I'll join whenever you.
Sure, sir. So before letting him to speak, I think I should introduce him to you all. Dr. Kenjom is a commandant in Reserve Central Reserve Police Force (CRPF), serving the services since 2000. As a qualified sports medicine specialist, he is the chief medical officer in charge of sports and training of the CRPF personnel. After completing his MBBS from KGMU Lucknow, he upgraded his skills in pediatrics from Safdarjung Hospitals, Delhi. He had also done his post-graduation in sports medicine from the Netaji Subhash National Institute of Sports, Patiala, and fellowship in accident trauma and emergency from MS Ramaiah Medical College, Bangalore. Being the in charge of the Sports Medicine and Sports Sciences Center of the CRPF, he is responsible for managing 40 central sports teams, including men and women of CRPF. He's been team physician for various sports teams and has accompanied them to various major events globally. He's been the team physician for both men's as well as the women's senior hockey teams during the 2016 Rio Olympics. The list of events in which he has officiated as Chief Medical Officer goes endless. To name a few, they were Asian and World Wrestling Championships, World Boxing Championships, International Badminton Championships, and World Soft Tennis Championship. In 2017, he was also selected as a team doctor and sports medicine specialist to the Indian police contingent at the World Police and Fire Games held at Los Angeles, US, which won numerous medals for the country. His sincerity and dedication to his work has earned him accolades not only in CRPF but also at the national and international forum, especially in academics and as a sports medicine physician. He has been awarded Director General's Golden Disc with 3 stars and many more commendation letters to his credit. He is also the first Indian to be certified by the ITA and the IOC as an international doping control officer and was also in charge of the medical and the anti-doping implementation in the ICC T20 Cricket World Cup held in 2016, both for men's as well as the women's in India. He is a national level badminton as well as a football player and currently the #1 ranked lawn tennis player in CRPF since last 18 years in men's singles. With immense experience in the field of sports medicine, I'm sure he will be sharing with us the key pointers one has to keep in mind while being part of the team as a team physician. Over to you, sir.
Thank you, Guru. I don't call you Chandrasekhara, I call you Guru. And thank you so much for that wonderful experience. I don't know, introduction. I don't know if I could have done it better. Am I audible?
You're audible, sir. Yes, sir. Please go ahead.
So before this, I would like to just say one thing, which to all the young doctors who are going to join, which Dr. Rajiv sir has said, being a stalwart. And I mean, Dr. Rajiv sir, and so many of the seniors, especially Ahuja sir, these guys are legends, for the sports medicines, and they can say almost the founders of sports medicine in India. So the take-home message which you take from sir's lecture is passion. You should have passion for sports. If somebody doesn't have passion in sports, I think he has no business being in sports medicine, sports physiotherapy, anything to do with sports. If you don't have passion, I mean, you will always be frustrated. Like you said, he got into radiology. In our time, when we were doing PG, if you want a seat in radiology, the only criteria was get a first rank in the entrance exam. Now, which is called NEET. In our time, it was the All India, PG entrance exam, AIMS. If you want a radiology, sir had got radiology, he left it. Right. So that's what he said, because then he found a passion in sports. So I would start with say, you have to find out passion. And then again, coincidentally, the slogan for the Rio Olympics, because today I'll focus a little bit more on Olympics, because we got a lot of wonderful and fantastic speakers, and they'll all be overlapping. So I know Colonel Anup is going to speak on team physician, Colonel Rajesh Adhau is going to speak on what is required in games. Amol is going to speak, and all these guys have worked at international levels, and they are fantastic academicians and experienced sports medicine specialists. So, I will just try and then leave out the parts, where I'm sure they're going to cover it in more detail. So once again, I say thank you, Rajiv sir, for that wonderful talk. And then also, once again, I say you need to have passion. So I'll just say, if you look at the background of my education, I have passion for pediatrics. And I've done if there was MD in emergency medicine, I would have done MD emergency medicine. I used to love, we say in Hindi, kaat, peet, khoon, ye, wo, you see 10,000 pieces of the patient and you put them together. That passion, but that has helped me. But there was no MD or MS or anything in sports medicine. And still now, I think we don't have. We just have fellowships and all. So I've done everything, ATLS, BLS, ALS. I've learned from first aiders. I've learned because I have that passion. But I had another passion, which like sports. I had a background of sports. I had another passion for sports. So I was forced to do sports medicine just for a lot of people to know. But I just felt that the passion was there for sports. So it took a year for me, to do a lot of research and find out whether I should take up sports medicine. Then in our time, there was only MCI recognized diploma. Now you guys are also lucky to have MD. I'm so jealous. So I would say once again, just have the passion. Once you have the passion, you are going to find ways and means to move ahead in your career. So I will start my talk now. Can you allow me to share my slide? Okay, is my slide being seen, Dr. Guru?
Yes, sir. Yes, sir. Your slides are
All right,
visible.
so I'll start.
Yes, sir. Please go ahead.
All right. So I had the good fortune, and again, one more line which Ahuja said, there are a lot of, we all feel there are political involvements and all that stuff will not go to getting selection for a team. But like sir said, keep on doing the good work, keep on doing the good work. You will be somehow recognized. And I was so lucky to be recognized for my work, which somehow things set into place. Then I can thank the players first who recommended my name, the team physios, even the masseurs, the chief coach, the whenever I got the opportunity, they'd come to Delhi, they would need a doctor, I would help them out, and with no interest that I would be going to the Olympics. Just to let you guys know, when I was asked to go for the Olympics, I didn't even have my passport ready because my addresses were all changed. I was traveling, being in the forces, you are traveling. I was in Kashmir and I was in Delhi and I was in Patiala. So I didn't have proper address. I didn't have anything. So I didn't have my everything ready, that way. So another advice to all of you would be that have your passport ready. You never know when you're going to get a call. Have your passport ready, have your MCI certifications ready, have your good standing certificates ready, because they were the personal challenges for me actually initially to just get into the team. And the other thing is, of course, uniform services, permission is such a big issue from the department. We get recommended, we get called, we get appointed to the teams, but somehow because the commitment to our own departments is so much, being the only sports medicine specialist, as Dr. Guru said, I have 40 teams to take care of, training and soldiers. So if you look at it, being in the uniform services, the criteria is more for emergency medicine, saving lives, anti-militancy, all the operations. They seem to be more important. They are important if you compare to sports. If I was working in Sai, maybe because then the sports would be more important. So I'll just reduce this just a second. So it's taking time. Okay. So, like I said, I would thank everybody, right from the Federation to the IOA to everybody who, recommended my name. And then I managed to finally clear all the necessary documentations to finally make it. So I'll just talk about the Olympics a little bit. The Olympic Games, is a unique and huge international mass sporting event. So, multi-sport, right? Many sports. So, and it represents the penultimate competition of an athlete's career. So when you look at an athlete's career, you may win everything, but you just say, I need an Olympic medal. Roger Federer has won everything, has not won an Olympic. He's won in the mixed doubles, but people still say he's missing that. So, and now it's not just the athlete. It's also for a doctor to say, okay, I've been to the Olympics. I've been to a physiotherapist, a coach. So even just to have participated is such a huge, you can say, an achievement. So you can understand what it is for the athlete. And you have unique challenges, including acclimatization to a new country, travel, geography, foods, and language. And the athlete has the pressure from their coaches, from their country, from the fans of that particular sport, but also a global audience. And the pressures coming from stress-related issues. Yesterday, Saurabh Chaudhary, he topped in the qualifying. And I just feel that there's so much of pressure going in as world number one, then topping in the thing. Just a hair-breadth mistake, 1 or 20. In the finals, he was not able to. We were expecting a gold medal from him. So pressure and so much of stress. And that's where the doctors also are there in the team who can help our athletes in being able to solve the problems. So again, with all the sports medicine specialists or anybody related to elite sports, I say you have to be able to enjoy working in a complex and challenging environment and be passionate about working in sport, which again, Rajiv sir had just mentioned. Just talk about team physician. I will not go too much into the details because a lot of fantastic speakers coming out who go into detail. But I always say, remember that the team physicians have the leadership role in organization, management, and provision of care for the athletes on the team, including the support staff and anyone associated with the team they are responsible for. And always remember the roles and responsibilities of the team physician are ever evolving. Why? Just look at what Sir spoke just now. He was a team masseur, he was a team physio, and when I'm working with Olympics and international elite athletes, and even now with some of my CRPF, I do have a physio with me. I do have a masseur. I do have a coach. And at this level now, we have sports sciences. So we can focus a little bit more on the medical aspects, on the scientific aspects. We have, if you look at the hockey now, we have a psychologist working with them. We have sports nutritionists working with them. So we have a strength and conditioning coach separately. We have, different coaches. So I can focus more on the medical aspects. So, and that they keep evolving. So we have to keep updated, like Sir said, you have to keep updated. You have to be on your toes. With later, it's not just in sports, but whatever you are as a doctor, in the hospital, we are the stars. In the hospital, we are the stars. I'll tell you, one of the challenges working out, we are not the stars. All these hockey now at my age, say I am, senior. So I go there, the guys whom I am treating, whom I have to really care for, sometimes I help them with their bags, are actually in the police. They are like 3 ranks below me. But today, I'm the team doctor. He is the star, or she is the star. So we have to understand that. So just a small little slide here to understand that there is my athlete and team. There is a team physician. But if you look at the coach, trainer, physiotherapist, anybody, ultimately, no matter how good a job we do, if the athlete wins a medal, like say, we can all say like, okay, because that's the ultimate goal. And that's what is different from a normal doctor. What a normal doctor does is, my patient is walking and running and doing well, fine, it's great. But you may have done your best job. You may have treated him the best possible way. You have given everything. But on the day, even your athlete has actually performed above his potential. He has broken the national record, but someone else, Carl Lewis or Usain Bolt, is there. So, it is there. So, but if my team had won gold, you become more credited for the work. So, but that's what I'm saying is, we have to just keep focusing on working. Do not worry. Yes, it's great when we get results, even if you don't get results. And I think the best time to help out your athletes and all that is when they don't get results, is the time when you need to go back. Because this Olympics is over, then immediately after this, the World Cup is going to come, the Commonwealth Games champion is, and that's what we always say, form is temporary, class is permanent. This is what we always tell our athletes. All right, so we have a wide range of tasks. I will not go into the details because we've got speakers who are going to come in that. When I saw the, when I prepared the slides, it was like, I thought it was just me or 1 or 2 doctors, and I didn't know the topics, who the other speakers are going to talk on. So you just see there's one thing, like I said, it's about performance. It doesn't matter what you do, it's all about performance. So what are the work we do? So performance decrement, if we don't treat them properly for prevention of illness, making correct diagnosis, recognize overtraining, injury, illness, overtraining, on all the things related to injuries, which can lead to the decrement of performance. And then the other thing that we do for performance enhancement, which Sir spoke about just now. So we do all the nutrition, the periodization, altitude, training, heat, optimizing training, nutrition, recovery. So when you're with the team, like Sir, he just said before me, is when you're there involved with the seniors, involved with the federation, you can put in, give in your inputs. Look, we need to acclimatize. For example, now Japan is hot and humid. We need to take up athletes, COVID situation. How do we do it in India? Maybe we train in Chennai. Maybe, that's how you acclimatize. So that would really help. So, and the most important job, like we say, protect health and performance, prevent injuries and illness in everyday routine. Our job is to keep the athletes healthy. That is the most important thing to perform. All team staff should support this paradigm. Don't forget about, the environmental factors, altitude, time zones, temperature, allergies, local disease, pollution, UV radiation, differences in food, water, depending on the sport too. Pay attention to small details. Like if you all remember Beijing, the issue was pollution. And Brazil, the issue was heat, humidity, and more than that, it was a Zika virus. So I was actually discussing, my athletes would come and question me, those who are married, sir, the questions related to Zika, because it was that, should we go ahead with a pregnancy? Should we do it before this? Should we do it after this? These are all you need to know. And then of course, yellow fever vaccinations. So you need the vaccinations in place because like most, you don't understand, to go out with the yellow fever, to going out of India is not a problem. When you come back to India, that's when you need. So you've got to know about the global diseases, check up the WHO website, see what are the disease prevalent in that country, speak to friends, doctors, colleagues, batchmates. Like for example, I did not go to Japan, but my athletes were going to Japan. So I have my batchmates or my childhood friends, a few of them were working in Japan. I was getting first-hand information of the situation over there. So I was able to guide my athletes. I was able to guide my players who were going there. Even if you're not going, you're not the team doctor, whoever is going there, I was able to guide the physios and some of the doctors too, who, were supposed to go with the team or working with the teams. Like I said, attention to small details. And of course, details when you're traveling, the athlete, venue, sport, travel, transportation. So sports specific, you need to have that knowledge. Duties and responsibilities, then I said, I'll just count them for you, a few 10 things, because the details will be given by our speakers coming behind me. Injury management, illness management, of course, on and off the field, prevention of injury and illnesses, acute emergency care, medical and musculoskeletal both, acclimatization issues, very, very important, jet lag, heat, humidity, altitude. Just for example, altitude, like if you all know this one, there was one World Cup where Brazil didn't perform. In Mexico, they were expected to be champions, but they could not manage the altitude because the altitude was different in Mexico. Germany went and camped there 2 months or 3 months ahead. And Germany could camp because most of the international athletes are playing in the Bundesliga. When they're playing in the Bundesliga, it's the same sports federation, right? Which is making most people don't understand these nitty-gritty things. That's why you need to get into the details. So that's why they were able to free all their players for national duty. You must have read so many times that the clubs don't spare the players for national duty, for the international, because the club league thing is going on. I've paid millions and billions of dollars or euros for pounds for this player. So they get to join, the star players get to join. That's why they never perform as great as they do in the clubs, because the 9 or 10 months they're with the clubs. So that is important when I talk about all the small nitty-gritty stuff. So the anti-doping issues, including prevention of doping infringements, you have to know your all anti-doping rule violations. And especially when you're going to a major game, the athletes are supposed to also complete the online program, like the integrity and the anti-doping knowledge for athletes. As a doctor, I need to do the team physician WADA toolkit. And so what we do is we help the athletes, because most of our athletes, especially in India, are not very highly educated. Now a lot of people have become tech savvy, but when we went before the Olympics, a lot of my athletes didn't really really not tech savvy on how to use Wi-Fi, how to use this. And so we had to sit and help, take out time and help them. If you look at it, it's not a medical duty, but as a team physician, it is. So for the Olympics, major games, they need to do all the integrity, athlete integrity, knowledge, confidentiality, and anti-doping. Okay, and you need to educate them on anti-doping rule violation. You keep educating so much that my athlete even has a fruit which is different from what is being given, or some sweets have come from home. They will actually ask me, sir, can I take this? Doc, can I take this? Okay, so then you work on optimizing performance, including nutrition, hydration, screening for overtraining. So that is nowadays actually I was working with the hockey team at the Olympics. So we had the sports sciences, we had the sports physios who were also highly educated. And, we all worked as a team, and we were able to take care of that. So counseling the players and the staff, occasionally the parents. So again, this in discuss can be talked by my speakers behind me. So I'll just tell you one small example. The first day on the ground, one of our top players, I can talk about it now, Navjot, she's playing the current Olympics. Here, my junior residency in burns and plastic surgery really helped. We went to the ground. Last minute, she was hit with the ball. Her entire this thing has gaped. I had almost what you can say, almost 3 or 4 inches gash on the wound. I didn't panic because I'd already done so much of emergency duties, worked in plastic. I went there. Parents were panicking. They were calling me. I did the suturing, and then I've worked with 6070. I just quickly sent somebody to get me a 6070 at Bangalore itself. I sutured her there, spent some time, and today you don't even see a scar on her face. So the one thing I counseled the parents was, don't worry, आपकी जो कुड़ी है उसकी शादी हो जाएगी. First thing parents was, डॉक्टर साहब उसकी मुंह खराब हो जाएगी, उसकी शादी कौन करेगा, ऊपर से खिलाड़ी है. I'm just telling you, these are the kind of issues you actually need to handle. So you do the medical aspect and reassuring the parents also. And then once the parents are reassured, the player is now totally also no longer focused on her looks. She's focused on the game. Okay. And that also got me an incident when we keep telling, why don't you wear your face mask when you're taking a penalty corner? Most people don't take it seriously. So after that injury, all the players ensured that when they are taking a penalty corner, in the box, all of them wear the protective guards. So the prevention part also comes into that. Coordinate pre-participation screening is very important, which we did with the teams. Examination and evaluation. International travel, again, I discussed, we talked about medical travel rules, acclimatization, etc. Okay, so I'll just talk because now we're talking of international travel mainly. So international travel with the teams could be, first thing, like I said, I had an issue was with the passport. So ensure that you have the passport in the correct address. in your home address and their passport is not expired. And when we work with, when I go for the World Police Games or anything that I go from the military, paramilitary, we go on a white passport. That's a different issue. So it goes by government. So we need to get a white passport also done. So, and then the entire process. So you need to know and educate your athletes on that so they can focus on training rather than going to the passport office day in or to the visa office day in and day out. They should be just going once for biometrics and once to whatever question and answer session. I don't think so. Your athlete should go more than twice. So we nowadays with the elite athletes, we have people in the federation who do this, but maybe at the military and at the paramilitary, sometimes we need to step in as doctors because, or if the doctor is not there, then the team physio normally does that because they're highly educated and they've traveled a lot, they have the experience. Because we need our athletes to be free to train, practice, and recover. If they're standing in the visa or they're stressed out about the visa and the passport, they will not be focused. And sometimes when you're not focused in contact sports, on high speed sports like hockey and football, you are bound to get injured. That's one way of preventing injuries. We should look at it. Okay, so we talked about acclimatization, jet lag. I said about sleep. Sleep is so important for recovery. All right, language, culture. We need to know about the drugs and medicines permitted in the country, the legal issues, and the therapeutic use exemptions. I didn't require it for any of my players, but we need to know the TUEs. You apply the TUE in time if it's required. Medical, I'm sorry, I'm getting a call from the organizers. Oh shit, I need to fast up. Okay. Medical protocols of the country traveling to, immunization, vaccinations, we talked about. Recognize the plan for possible medical issues related to traveling with athletes, recognize the environment, okay? Formulate a clinical approach to common illnesses related to travel. And of course, remember one important thing is the media. You need to be very careful because I remember they always ask, how will your team perform? What is the injury that happened? I don't talk about it unless I'm permitted. We don't. We let the chief coach handle the media. We let the performance director handle the media unless we specially told, okay, I'm allowed, or they want to take an interview, and then the federation or the chief coach says, no, you need to give a talk, but this is what we need to talk. So we normally have a quick briefing. We normally have a very quick briefing on what we can say to the media. Of course, and always player confidentiality is so important. We should, so like I said, respect the confidentiality. Don't just post pictures left, right, and center. Think before you post. Sharing images of athletes and your colleagues in the media, always take permission from them, which we don't. Stay up to date and aware of new platforms that athletes can use to minimize the risk of misinterpretation. When there's misinterpretation, the athlete gets stressed, and when they are stressed because of the trolling or memes or anything, again, our job is to ensure that so these are small things that you can help your athletes with. Know your relevant profession's code of ethics, conduct, act as a reference point to help generate good social media etiquette. Okay, so quickly going to the Tokyo Olympics, I'll just say that this was the instructions we gave to the players, which is all over the media. So I'll cut it short. There's a playbook Tokyo 2020 to be read and understood. You're all doctors and physios, well educated. So these are the things. The CLO infection control here they need to take, and CLO is basically the COVID liaison officer who is going to take care of this. So COVID has been a big challenge, very challenging, and I'm sure all of you. Then here again, in the last Olympics, I was helping them with the Get Set and the Samsung app. Here, the doctors will probably need to help them with the Cocoa app because it's important, for COVID. It's same the thing like we had the app in India. So you need to sample playbook, it's over there. And those who don't have it in the groups and all, I'll request Asha to share it on social media. It's available in the internet through the Wado website also. So I will not go through this because we are short of time. But, I'll just say that the medical planning needs to go way ahead. So we talk about incidents and injuries. So another role of the doctor here is you need to have a daily report on injuries and illnesses. So this is the form which the Olympic committees will be giving it to you. Now you have additionally COVID. So you can go through this. It's available in the IOC website too. All right, the injuries and then the codes and classification. That's how they get the data. All right. So caring for the national team, again, the core goals and missions, like I said, was fielding a healthy team, safety, optimizing the athletic performance, efficient and effective response to injury and illness. Right. So what I'll do is, I'll just tell you pre-participation medicals. Again, I think we're going to have someone to talk behind us. So unique challenges, like I said, is you need to have your licensing. So normally they help you. Good standing certificate would be one. Have your MCI registration, and new doctors, probably the new National Medical Council. All right. So this would be the bag that we travel, and the federation or the IOA gives you these bags. Ensure that you have an AED, or if you cannot carry one, ensure that the contingent doctor has it, or wherever you're going, international tournaments, they have it. But it will be good if you can carry. It's very light if you can have it with you. When you're traveling with the team, excess luggage is taken care of by the federation, the fees and costs. Okay. So accreditation is very important. Don't forget that you need to have your accreditation at all times. I will just say the ABCD of being a successful team physician from my say in a simple language. I always thought that efficiency, skill, knowledge. No, A is availability. If you're always available to your athletes, then you're a good doctor. Then comes your behavior. You may be very good, you may be available, but you are like, okay, gung-ho, I am so-and-so, I am commandant, and I'm not going to talk to you guys properly. You are a constable. Most of the people in the police are much lower to me in rank. Sardar Singh is the captain, say he is lower in rank, but I got to treat him as the captain of the team, not as a SSP, a junior to me. So that way, so the behavior is so important. Of course, then capabilities, skills, then the equipments that you have, and your dedication that you need. So this was with the women team. The only reason I put up this picture here is, like I said, you need to have excellent teamwork, especially with your team physios also. So because you sit together and you work, right? So this was the support staff, and this is the coaches for the men's team. And accreditation, I'll just spend a second here, please. You'll understand that it's very important why I put this up. Sir put up the medals and all. Of course, you get to work. I was fortunate to be the team doctor for men's team and the women's team. It was crazy. I just did not have time. Like Sir said, no sleep, nothing. And then contingent, because I always see these athletes, even when they're not, with the teams, or when they're off, when they're not in the teams, when they visit Delhi or whenever they are, they always consult me. So, you end up taking care of them at the village also, if they don't have a team doctor, because they know you. So athletes tend to go to someone who they know. They may have a much more higher qualified, much more knowledgeable, much more experienced doctor there. But if they have not worked or interacted with the doctor, they will always go to the doctor, or even the physio, or even the dental surgeon whom they know. Okay. So now just note the accreditation here. It's written medical personnel. I'll just tell you, because I face this problem. So what happened is, when I was prescribing drugs, I've carried all the medicines, but sometimes such situations happens where those medicines are required, which way, by chance, support staff or somebody, needs it. And everybody's important in the team. Like Sir said, you need to take care of everybody. So I went there, when I was writing a prescription, I was wondering why they're checking my accreditation on the card. You just need to put the scan. But they were looking at me, they were checking. Then my team physio told me that, sir, actually what is happening is, when you write medical personnel, here you see, I got the accreditation card. It is written doctor. So this was the issue. I had a few, another challenge, anybody going for a team, these you don't buy, you don't choose, you exchange. So for exchange, you need to have your Indian pins. You cannot buy them. So kindly ensure that in India, you manage to have enough India pins with you so you can have more. I had very less India pins, so that's why you see much lesser pins to me compared to what it is. And then sometimes your athletes say, "It's such a nice pin, give it to me." Oh, I say, okay, fine, take it. This is again Shrikant, he's one of the, Shrikant and Sonika, they're top physios. They made my work much more easier, especially when we had to decide. Their challenges are there when you need to decide whether the player can play or not. So I'll just tell you, we had a very serious injury of a player. We all sat down together with the coach. One of the challenges was to take that decision, should the player play or not, because it's the team and the country here. It's not that the player needs to have an Olympic stamp. How important she is to the team, or he is to the team. So I'm so happy to say that there was one decision which we took. We had 6 hours of meetings, and that player went on to become the Indian captain, to have a Arjuna awardee, to have a Padma Shri, name this thing. So we had such a good team. Thank you, Shrikant. Thank you, Sonika, especially my top physios who've always been standing side by side, especially taking those crucial decisions, not medical decisions, the musculoskeletal issues, the injuries, whether we can put the player back in the hockey. The unique challenge is, once you pull out, not like football, once you pull out the reserve, that reserve goes home. And the players who are sitting outside of 16, 18, they come in, this player is out, cannot come back to the team again. So this is one of those unique challenges. So you need to be really, out of experience, and you will have to be very clear about keeping the team first. But sometimes you need to take everybody's help. This picture is basically another challenge. This picture of my wife, one of the biggest challenges was my wife is in the games. I needed to take permission from the coach. Imagine at this age and time, already married, I needed to take permission to go and meet my wife because I needed to be accessible to my players all the time. At the time we just landed, I did not have phone. Okay, I have a phone. I had Brazil. My wife was already there a month back. So she already arranged the phones and everything for me, the network. But my players didn't have the Wi-Fi at the time or the phone, so they could not call me, So I used to go, I probably met her only thrice in the entire Olympics. We were there for almost a month. All right. So this was one of the unique challenges. And the other challenges was for those who are pet dogs and pet parents, you're very stressed out when my wife is at the Olympics, I'm at the Olympics. I just kept somebody to take care of her and she was not eating and drinking. And so you also get stressed. So pets, why I give an example is pets, parents, children. So before you leave for an international tour or big tours, make sure your friends, colleagues, relatives, everybody, that the medical aspects, the emergencies are also taken care of. So you're not on the phone all. Imagine somebody is having a serious issue at home. You're in a match. You cannot pick up the phone. So take care of that too. Okay, this is my pet dog, Steffi. And she was seeing us off when we were moving to the Olympics. So I'll just say take home points. Remember, when caring for Olympic level athletes, the healthcare professional must be aware of the unique demands and pressure of this often once in a lifetime experience for athletes and even for yourself. Injury and illness prevention is the key to optimal team performance at any Olympic Games. Special planning and preparation is necessary to manage a national team in a foreign country, including travel, nutrition, and access to healthcare. And most importantly, care for yourself. Exercise, train, be fit, because remember, we are humans too. We also suffer. We talk about everybody's jet lag. We don't talk about our own jet lag. So we also need to take care of ourselves. And the challenges I told you was the unique challenges of my wife and my dog, So thank you all for your very patient hearing. I wish you all good luck for your career and health. Thank you, ISSEM, and of course my department, CRPF, for having forced me to take up sports medicine and then work so much with sports that today I'm able to sit here in front of you and talk about the Olympics. Thank you so much.
Thank you, sir. Thank you for such a wonderful talk. I know the kind of experience you have. The time slot given of 20 minutes is very less. So with
yeah, but thank you for calling me. I tried to rush. I'm so sorry if I took time.
However, sir, the talk was very lucid, and you could give us very minutest of the details one has to take care as a team physician when you travel with the team, both abroad as well as within the country. So thank you so much. With the paucity of time, I think
absolutely no problems.
So all the questions coming up, the questions would be in the chat, sir. I'd be happy if you could respond to the questions.
I'll try and answer to that.
Yes.
So I'll go to stop sharing now, or you'll get me out, right?
Yes. Sir. So we will go on with the next session.
Thank you very much.
Thank you so much, sir, for the talk. Thank you.
Thank you. Thank you. I'll answer the questions in the chat if there are any. Thank you.
Thank you, sir. So moving ahead with the webinar, we have the next speaker with us, Colonel Dr. Rajesh Adhau. He is MBBS and DSM. He is going to give a talk on sports medicine specialist. It's a must with all competitive sports. Yes, after a session on challenges faced by Dr. Kenjom, now we welcome Colonel Rajesh Adhau. He's a Sena medal to trigger your thoughts and question you whether sports medicine specialist is must with all competitive sports. Good morning to you, sir.
Good morning. Good morning,
sir. So let me introduce him to you all. With immense pride and respect, I introduce one of the most decorated sports physician from the Indian Army, Colonel Rajesh Adhau, Sena Medal, a gallantry award winner in Kargil War when he served with 13 Jack Rifles, bravest of the brave battalion. Colonel Rajesh Adhau is a senior science expert and associated with various sports tournaments and Olympics. He has worked as the team doctor in various international events, including 2011 Rio 6th World Military Games held at Brazil, 2012 Asian Beach Games held at China, 2012 World Boxing Series with the Indian team at Italy, 2013 Senior Women Hockey World Cup at Netherlands, and 2013 Junior World Women Hockey Cup at Germany. He was also the doping control officer at the Commonwealth Games, 2008, 2010, and associated with the BCCI, IPL, and World Cup 2020 cricket. He is an adventure and extreme sports athlete himself. He has summited Mount Bhagirathi 2, Mount Rio and Leo Purgyal, Mount Stoke Kangdi, and has been part of many mountaineering and motorcycle expeditions. Recently, he created world record for covering world highest passes across Ladakh in motorcycle expedition, which has featured in Indian Book of Record 2020. He is also an ultra marathon runner and ultra cyclist, wherein he has taken part in many marathons, including Kardungla Challenge, covering 72 kilometers, Kargil Ultra Marathon Challenge, covering 164 kilometers, and as a cyclist, he has cycled over 4,000 kilometers in 100 days. He has had an illustrious career in the Indian Armed Force, commanding various key hospitals. He has commanded the Armed Forces Sports Medicine Center at Pune between 2011 and 2015. He is the scientific advisor to Integrated Sports Science Research Organization of India. Adhau has also published papers on various topics which have been published in eminent journals, including the Journal of Physical Education and Allied Services, Muscle, Ligament and Tendon Journal, and the Medical Journal of Armed Forces India. Welcome you, sir, on behalf of the ISSEM team, and feel pleased to host you today for the webinar. Over to you, sir.
Thank you, Guru, for the introduction. And first, I will compliment Dr. Kane and, of course, my regards to Dr. Ahuja, sir. They spoken very well, and I will not take too much time for introduction because Dr. Kane took my time, not my time. Dr. Kane is always, helping us, particularly me, and you can organize one session, full session, day session with Dr. Kane, and you will get a lot of insight. And thank you very much for you and Barun organizing such this topic and this webinar as the first webinar since we are talking about our society, ISSEM. And I wish all the best, and we will do the many more such type of webinars. This is just today is the introductory webinar like this. Yesterday somebody asked me what type of webinar Sunday you are going. So I said ki doctor with the Olympic or doctor should be with the all team. They say ki why not it in much before the any game. For example, Olympic game or some major games, and you should organize such type of webinar so that this type of webinar will reach some news to the government or SAI, and they will take the concurrent about our views, sport medicine specialists, so that they will think whenever a team will going out or contingent will going out, there will be maximum sport medicine specialist participation with the teams. So they give why after the event, why not before event? I said we are going to do our best in next year or so, or next Olympic, the maximum doctor will go as a sport medicine specialist doctor, not other doctor. I mean, other doctors also good, no offended to other doctors, but what Dr. Kane said and what Dr. Ahuja said, and I want to repeat again, you should be the part of the team, part of the team, passion for the game, and you should be speak with their language. What I mean to say, I will just explain. I don't have the slide presentation because I didn't told Dr. Kane, and he always helped me to make my presentation. What I mean to say, you should be a part of with the team, part of with them, and I will share some my experiences with the international events. Whenever I was a team doctor, what Dr. Kane said and what I wanted to say, you should be the amongst the players. What they speaks, what they want to behave, and you never think yourself you are a colonel in the Indian Army and your player is a sepoy or like that. When I was in Brazil with a military game, my one long jumper come to me in the evening and he said ki sir, my quadricep is sore, what to do? I said ki koi baat nahi yaar, ab abhi thoda release kara dete hain. I called physio, and physio was maybe busy. He said ki sir maine nahi karna uska, hai na. So I said ki okay, hai na, no issue, and I will do the massage for you and I will release your quadricep. and he said कि sir आप अगर कर दोगे ना तो कल मैं देखना qualify कर दूंगा first 8 में, मतलब, and true to his word, I did a whole massage to him, है ना, of course physio came later on, and he qualified in first 8 in next day. So आप उनसे अगर पार्ट बन के रहते हैं टीम का, so जो साई है, जो बड़े फेडरेशंस है, उनको मैं हमेशा ये बताते रहता हूँ, उनके ओहदेदारों को, उनके प्रेसिडेंट को, कि डॉक्टर इज नॉट जस्ट फॉर द इंजुरी मैनेजमेंट, डॉक्टर इज नॉट जस्ट ऑन द ग्राउंड, है ना, एज अ डॉक्टर, डॉक्टर इज एवरीथिंग फॉर द प्लेयर. Player only speaks truth, only speaks small thing in front of doctor, not even the coaches, not even the player. I know I was with the in Germany in Rotterdam with the Indian hockey team, senior hockey team, women's, and we lost 2 matches. And I just sit down with the girls and I said कि यार ये क्या कर रहे हो आप लोग, है ना, इतने अच्छे प्लेयर हो आप, इतना अच्छा गेम है आपका, इतना अच्छा आपका एंडोरेंस करके रखा हुआ है, एंड व्हाई यू आर लूजिंग. सम ऑफ वन गर्ल से कि सर हमें इंडियन खाना खाना है, आप हमें इंडियन खाना खिला दो. सिचुएशन ये थी कि हमारा कोच फॉरेन कोच, कंडीशनर कोच फॉरेनर, इवन दो मैनेजर से कि राजेश विल लुक आफ्टर द न्यूट्रिशन, बट दैट कंडीशनर कोच से कि नहीं, only girls will eat non-veg, they will not eat anything else, there are a lot of protein, whatever. So I insist, Mrs. Patak was the team manager, and I went to her in the night 11 o'clock and I said, ma'am, there is a request from the girls, they want Indian food. There are 3 days in gap, 3 days के बाद matches होने हैं ma'am, and they want Indian food. She said कि नहीं मैं कुछ नहीं कर सकती, because that coach, Indian Australian coach was there, and he said कि no, I don't have money for Indian food, whatever the money I have, I given the advance to the hotel. And then I said कि पाठक मैम अगर मैच जीतनी है और आगे वाला मेडल लेना है तो इनको इंडियन खाना खिलाना ही पड़ेगा, बिकॉज उनकी मेंटेलिटी इस टाइप की, और मैं आपको बता रहा हूँ. Then next day she fought with the coach and we went to the very good Punjabi dhaba in Germany, and true of that girls spirit, we won continue 3 matches and we won first time what are you in the medal that year. That much of you have to be involved with the team, any team, and so you should be the listen their language, players language. There is so much of pressure, what Dr. Ahuja sir said कि सिलेक्शन कहाँ से होता है. हर प्लेयर को ऐसा लगता है कि अगर मैं कुछ कोच को बोलूंगा आज मैं ठीक नहीं हूँ, आज मैं खेल नहीं सकता, so coach will give the negative report about me, and next match I will be not there, or next tournament I will be not there. So the players will not speak to the coaches, player will not speak to their managers, player will whom left the doctor, and that's why they speak each and everything with the doctor, and doctor has to convey the positive message to the coach oblique manager. That is very, very important, and you should give your holistic view. It is not only the player one-sided version. You should see the player's condition, you should see everything about the player, and tell about. I was with the World Series boxing and I was in Milan, so I told coach, sir, we are in practice session for 15 days earlier, and then there was the matches. I told coach, sir, see this bout of this England player. There was a team, Indian team with a mix, players from other countries also. And Rajesh, this player will give the medal to us and he will win. No, sir. He is not using his right hand. He is using only his left hand. Something is wrong with the right hand. He said, no, Rajesh, nothing is. I am seeing his bout and what doctor, what they said like this. So I went to the Indian manager. I said कि sir देखना ये बंदा मुझे नहीं लगता ठीक है, फिट है करके, and this is my opinion, but coach said कि he is a fit बंदा. I shown him the video of the practice. I said कि right hand something is wrong in right hand and he is not showing me. He said कि doctor everything is okay, see my movement is okay, good boxing is okay. And the managers asked the coaches and coach said कि नहीं, I don't know what about the doctor, but my player is good. We have the practice bout with the Tajikistan boxer, and just he find out his right hand, and after first 2 rounds, third round, he broken his, thumb, and he's out for the next whole tournament. Then I told manager, see, I told you something wrong with the hand. So you have to be honest with your team, honest with the player, and honest with the management. And you should do the each and every work. What Dr. Ahuja sir said, you are the masseur, you are the, even I was going with the Germany again with the junior women's team. In Indian airport, there was a chaos. One girl found his passport blocked, and then she can't go. That the immigration office say. And I went to the coach, again foreign coach. He said, I don't know anything. You people should come with the preparation. You should know what type of passport she is carrying, what is the allegation with her. And he went to the restroom and he just sat down. He said, I want team, I will not involve such type of. Then who left? Doctor. Doctor is running around with the immigration office and running around the airport manager, because that girl, they say she will not go. You can take out her bags, and her bags is already check-in luggage, and there is already in the near about the boarding to the plane. So running here and there, only the dedicated doctors. So you have to do each and everything about the players, and our players are the tremendous potential. Just we have to proper guide them, and their moral boosting is the most important part of the doctor. What I like about all doctors, whenever with the team, sometimes they feel shy. Even I may always feel shy with that foreign coaches, because they speak like they are god to the players. And but whenever you go to the coaches and you tell them this is problem facing the player, but most good about that foreign coaches, not our culture, they listen to you. They listen doctors. They said yes, if doctor is saying like this is okay. So you should be very honest about your opinion whenever you travel with the patient. That's why I always say one team doctor, that is the most sport medicine specialist, he should be accompanied with the team. Give them to 1 month before, even 2 months before the team, make him in charge of the team doctor, and he will mix up with the players, and team will get the good result. Because the moral boosting is the most important thing. I was what Guru said, and I am proud, and tomorrow is the Kargil Vijay Divas. I always remember each and every action in the war, and most important was the moral boosting. I always said to the Jawan, nothing will happen. You will win and you will come back alive. Even there was 2-3 bullets in his body, and he is surviving till today. Why? Because he know my doctor is there. Same applies with the team. If player को अगर बोलने के लिए कुछ होता है, उसके मन से अगर कुछ निकालना है उसने, हम हिंदी में बोलते हैं उसने कि मन की भड़ास निकालनी है अगर हार गया तो, कोचेस ने कुछ डांट दिया, वो उसने किसके पास निकालना है, वो कोचेस और मैनेजर के पास नहीं निकाल सकते. वो किसके पास निकालेगा? वो निकालेगा सिर्फ डॉक्टर के पास. एंड डॉक्टर उसको अच्छे से सुनेगा, उसका धैर्य बढ़ाएगा, उसको मोटिवेट करेगा, तो उसको एक नई ऊर्जा आती है और वो नया ऊर्जा के साथ दूसरे दिन खेलता है. दैट इज वेरी वेरी इंपॉर्टेंट. सो whenever such type of webinar will happen, and whenever Dr. Barun and Akshay and other people are pushing, हर टीम के साथ एक डॉक्टर होना चाहिए, बिल्कुल होना चाहिए. I am the most opinion कि whenever I was with the team doctor, टीम का मोरल एक अलग ही टाइप से जाता है. इवन अपने प्लेयर्स जो होते हैं बाकी प्लेयर्स से एकदम अलग होते हैं, they require some शाबाशी, they require some moral boosting words, and they will perform. स्किल्स की हमारे इंडिया में कोई कमी नहीं है. सिलेक्शन, प्रॉपर सिलेक्शन, उसके बारे में मैं बताऊंगा नहीं. देयर आर सो मेनी गुड स्पीकर्स, बट I always emphasize and I tell all players and all doctors, they should take good care of players, and we will win. We will win 100% we will win. And I remember the weightlifting, we got congratulations to all, we got the silver medal. I was with the weightlifting thing very short time in NIS Patiala when I was doing my post graduation, and there was one coach. That girl say ki nahi, I will not lift the weight. This is my final 92 kg. My weight is final. That lady says ki nahi, you can increase your weight. She said no. This is my last weight, and this category I have already selected for 92 kg. I will not lift the weight. That what happened, I don't know. I was with her. She coach came and she said something to in her ear, and I was there. I said, "Ki you can do it. I seen you in during the practice." And she went there and she said, "Okay, 108 kg lagao." Knee and she lifted 108 kg just without effort. जितना effort तो उसको 92 kg उठाने में लगा. So such type of cohesioness, such type of player, you know the player very well during the practice and after the practice, and she has been selected for some higher tournament. So this is the important. So we have to emphasize with the higher bodies, higher federation. कि doctor it is not only for the injury management. Doctor is not कि उसके पैर को लग गया तो वो उसको ठीक करने के लिए, वो तो है ही है, उसका प्राइमरी रोल वो है ही है. बट जो बाकी जो कॉन्फिडेंस बिल्डिंग, जो साइकोलॉजिकल सपोर्ट, जो उसका प्लेयर का मेंटल सपोर्ट, वो सिर्फ डॉक्टर ही दे सकता है. दिस इज माय फर्म ओपिनियन एंड नोबडी एल्स. इवन यू सेड कि मैनेजर, कोचेस, अदर सपोर्ट स्टाफ, नो, है ना. ओनली डॉक्टर कैन गिव दैट कॉन्फिडेंस इन प्लेयर. yes, coaches can give the confidence in their skills part, their technique part, but जो मोरल बूस्टिंग का जो सबसे इम्पोर्टेंट पार्ट होता है वो एक डॉक्टर ही दे सकता है. दैट्स व्हाई ऐसे कि एक किसी ने व्हाट्सएप पे आज लिखा था कि सपोर्ट स्टाफ में डॉक्टर और पैरामेडिक्स और ये आते नहीं क्या, बिकॉज गवर्नमेंट डिक्लेयर सम प्राइजेस टू द कोचेस एंड other managers and other people. If some medal come, there is no name of physiotherapist, no name of doctor, and no name of others. And somebody said ki there is a role of groundsman also. Yes, they also play the very, very good role. So our society can take home message is to take some points from this webinar and just flash in the website. Everybody, those who are supported to the player, they should get at least recognition. Not only recognition, शाबाश, है ना. शाबाश डॉक्टर वो कर लेता है, small groundsman, then supporter, then जो भी उनका किटिंग से लेके सब कुछ करता है प्लेयर का इन NIS particularly during the practice matches, they should get some recognition type of thing. And as a society member and as a sport medicine faculty, we should recommend to the government, just write something. Thank you very much. Thanks Guru to give me this opportunity to speak. And thank you Ahuja sir. I wanted to see you from long time and from Australia, and I heard so much about from my Dr. Ahuja sir, that my guru and our guru, in fact Dr. Ahuja sir, we always remember him in every session and everywhere until our last breath. And he told us a lot about you sir from Australia, and I seen you on the screen and I am very glad to see you. Thank you sir, and your blessing is always with us, and so we will perform well in future also. Thank you Guru.
Thank you so much sir. That was a amazing talk sir. You had shared your personal experience and the importance of the morale boosting, which forms the major kind of support pillar for the pillar of strength for the athlete. Sir, we have few questions coming up. So I have one question from self only to you. How do you compare yourself as a military doctor and a sports medicine specialist vis-a-vis attending to military person as well as to the sports person?
This specialty is very good specialty. Sport medicine specialty is very good specialty. I always put sport medicine into my military medicine and military doctor, as a doctor, I always go in any unit or any patient. I treat with the, my, thinking about athletes, thinking about the player, thinking about sport medicine. So always tell my, military people, you should be a military jawan is okay, but you should be a spirit of sportsman. And what the spirit of sportsman? Sportsman never ever give up. Sports,
Yes.
what sports we learn from the sports? Okay, this time silver medal, next time I will be gold medal, or this time I failed, okay, next time I will be win. So this is a very good thing about the sports person. So I always inculcate this sport medicine to my jawans, and my jawan is always disciplined jawans, and they listen very carefully, and this is very good. Thank you.
Sir, we have one more question. Sir, from Dr. Hanjabam only. He asks excellent practical tips and how management can be done at issues.
What?
Sir, the question is, can you mention the practical tips and how management can be done to address the issue of performance enhancement, which is again multifactorial. Since performance enhancement is itself multifactorial, how do you? What is your view on addressing this particular issue? Since you yourself.
Performance is multifactorial. And it involvement of coaches, involvement nutritionists, involvement of psychologists, involvement of from start with the ground. If the ground man say ki nahi, I will not open the gate today, whatever your practice is, and your motivation goes down zero, then like that. So performance is multifactorial. It is not only the doctor can increase the performance. Performance enhancement is a long procedure, and it involves nutritionist. I mean to say, nutritionist. You have to see the good nutrition. What other people say, you will the long list of nutrition. Ye khao, ye khao, ye khao. Nahi. I always ask nutrition as a team physician or team doctor. नहीं, मुझे वो दे दो आप कि एक कटोरी खानी है, 2 कटोरी खानी है, 2 चपाती खानी है, 3 चपाती खानी है. Don't say कि 60 milligram carbohydrate, 30 milligram of protein, 15 milligram protein, 30 milligram fat. No. है ना, my player listen only the ground situation. That means 2 केले खाने हैं, 1 एप्पल खाना है, 2 रोटी खानी है, 1 कटोरी भर चावल खाना है. So you have to be with them, with the team. So you have to interpret. When you speak to the nutritionist, you speak with your athletics language. What my athlete is required. My athlete require 60% of carbohydrate. How it will get? Don't tell me कि spinach खाओ. Don't tell me ये खाओ. नहीं, कितना खाना है, कौन सी क्वांटिटी खाना है, क्या खाना है. That's all. ये मुझे बताओ सिर्फ. ये काम करता है टीम फिजिशियन. वो न्यूट्रिशन दे देता है, पूरा का पूरा लिख के दे देता है कि भाई ये खाना है और ऐसे कि नो और टुडे अवेलेबिलिटी इज दिस, टेल मी फ्रॉम दिस मैं प्लेयर को क्या दे सकता हूँ एज अ टीम डॉक्टर. सेम विद द कोचेस, सेम विद द फिजिकल कंडीशनिंग कोच. आई ऑलवेज से कि माय फिजिकल कंडीशनिंग कोच फ्रॉम ऑस्ट्रेलिया 1 बजे प्रैक्टिस खत्म करता था प्लेयर की कोच. देन 1 से 1:30 बजे तक खाना खिलाता था. 2:15 में he used to take all players to the conditioning hall में in conditioning करने. I always say कि यार मैंने किताब में पढ़ा नहीं ऐसा कभी कि खाना खाने के आधा घंटे बाद आप उसको वेट ट्रेनिंग करा रहे हो, है ना. what is your aim, tell me. बोला नहीं, आपके इंडियन प्लेयर दोपहर में सो जाते हैं, चाय पीते हैं. मैं बोला what that mean कि you are doing the, वो सोने नहीं चाहिए इसलिए वेट ट्रेनिंग आफ्टर आधा घंटा खाने के बाद. सो उसका इफेक्ट इतना नहीं आएगा मेरे प्लेयर को. मेरे प्लेयर जब करना चाहिए, उनको चाय चाहिए तो चाय पियेंगे भैया, है ना. और उसके बाद देखना कैसे परफॉर्मेंस आता है. वी यूज्ड टू गो टू द डायरेक्टर एनआईएस कि सर इसको बताओ एटलीस्ट 1 बजे खाना खा रहे तो 3 बजे से वो खुलेगा जिम, उसके पहले नहीं खुलेगा. एटलीस्ट कुछ तो टाइम प्लेयर को होना चाहिए. सो यू हैव टू बी अ पार्ट ऑफ देम, and this is always multifactorial. It is not a one man show. It is even parents, even their colleague, even uska roommate. If you are with the player, you have to see what his roommate is doing. अगर ये एथलेटिक्स का बंदा है और वेट लिफ्टिंग वाला रूममेट है तो व्हाट दे आर टॉकिंग, और वो क्या बात करते होंगे, ये भी आपको देखना पड़ेगा. सो परफॉर्मेंस इज मल्टीफैक्टोरियल एंड वो मल्टी फैक्टोरियल का एक मोस्ट इम्पोर्टेंट जो दुआ होता है, जो जिसको हम बोलते हैं कि मेन मैन, दिस इज द डॉक्टर, है ना. न्यूट्रिशन अपना वो कागज पकड़ा के चला जाता है. फिजिकल कंडीशनर बोलेगा कि मैंने इतना भाई कर दिया, वो कागज में लिख देता है, इतना उसका RM है, इतना ही है, इतना ही है ना. कोच बोलता है कि मेरा प्रैक्टिस सेशन 3 घंटे का था, मैंने स्किल पढ़ाया. बात करने के लिए बसता है डॉक्टर. एंड दिस फैक्ट शुड बी कन्वेड टू द फेडरेशंस, है ना. देन यू सी द परफॉर्मेंस, है ना. वॉट एवर द परफॉर्मेंस कमिंग, इट विल इंक्रीज मल्टीफोल्ड, because we are the combining the all specialty, है ना, into one. Now what happened during the nowadays, है ना, everybody is going all the direction. We are, है ना, government is giving so much to the player, but everybody in different they are not sit together. I was with the NIS. There is one team came from Uzbekistan, boxing team. I was a part of that meeting. He asked wrestling coach, for how many times you and this boxing coach meet in a week? And we have the answer 0. Never. He said no. In our country, we sat together because the conditioning of this wrestling coach with the judoka, with the boxing, there are similarity. है ना. इन्होंने भी पंचेस मारने हैं, इन्होंने भी उसको ये करना है, क्योंकि स्ट्रेंथ गेम है. स्ट्रेन गेम में ऑल द स्ट्रेन जो गेम्स होते हैं, उन्होंने इकट्ठा आके बैठ के उसका विचार मंथन करना चाहिए, जो हम हमारे यहाँ नहीं करते. बॉक्सिंग कोच बोलता है कि माय बॉक्सिंग प्लेयर इज माय प्लेयर एंड मैं देखूंगा सब कुछ, है ना. सेम विद द रेसलिंग कोच एंड अदर कोच. बट सच थिंग विल हैपन इन कमिंग डेज एंड दिस सोसाइटी विल प्ले द मोर important role in future. I am very much confident. Thank you, Guru.
Thank you, sir. Thank you so much, and thanks for the wonderful question, Dr. Barun. And as you said, sir, the integration of multiple services that is available for the athlete is the only way ahead for enhancing the performance. Thank you so much, sir. Thank you for being with us today and with your experiences and sharing your various views on the aspects as well. Thank you, sir. So moving ahead, we are into the next session. We have.
बताओ ये सब कहाँ से बोल रहे हैं? एक ऑस्ट्रेलिया से, एक दिल्ली से, एक पुणे से. सबसे बड़ा आदमी मेरे को यही लगता सर टाइम.
Sorry for the technical glitch. Moving ahead with the next session, we have Dr. Krishnan, MBBS, DSM, PhD, speaking on traveling with an international sports team. So I must say I am privileged and honored to invite my own teacher, Colonel Anup Krishnan, for delivering a glimpse of his enriched experience with us on traveling with an international sports team. We welcome you, sir, to this webinar. Colonel Dr. Anup Krishnan is a practicing sports medicine specialist from the Indian Army since last 13 years. He has done MBBS from Bombay University and Diploma in Sports Medicine from National Institute of Sports, Patiala, and has also completed his PhD in sports rehabilitation. He has several certifications related to sports medicine from India and abroad. He has held various prestigious appointments in the Indian Army, including head of the sports medicine departments at Army Hospital Research and Referral, Delhi Cant, Army Sports Institute, Pune, and Indian Military Academy, Dehradun. He is faculty and examiner for the MD Sports Medicine program at AFMC Pune. He has been the honorary sports medicine consultant to the President of India from 2010 to 2012. He is experienced in all aspects of sports medicine, representing services team at several national sports events and India at several international sports events as team doctor and ringside physician. He has been instrumental in return to sports of several international sportsmen and is a panel member of the National Anti-Doping Agency, NADA, National Resource Referral Team of Experts, NRRT, and Target Olympic Podium Scheme, TOPS, of Sports Authority of India. He himself is a keen car rallyist and has participated in several car rallies across India. He has several research publications and presentations to his credit and has been awarded the Chief of Naval Staff Award for Best Published Paper in Medicine and Allied Subjects in 2017. And he was also bestowed with the Best Published Paper in Medical Journal Armed Forces India for the year 2018. Sports rehabilitation, doping control, talent identification and development, exercise physiology, and injury prevention are his key interests in the field of sports medicine. He is currently working as a senior administrator at Military Hospital, Jhansi. On behalf of the ISSEM members, we extend a warm welcome and express our gratitude for your presence, sir. Over to you, sir. We are all keen and elated to listen to your talk.
Good morning, ladies and gentlemen. I hope I'm audible. Yeah, thank you. Thank you, ISSEM, and thank you, Wing Commander Chandrasekhar Guru. You really are a credit to your teachers and your parents, and we are very proud of what you have turned out. Thank you, and I hope I'll be able to do justice to this topic. I'll just share my publication, the presentation. Is that visible?
Yes, sir.
Okay. So I have been asked to speak on traveling with an international sports team. I find myself at a disadvantage here because I'm following two Olympians and another international sports doctor in speaking, but I'll try and give you the capsule course of what all these stalwarts have been speaking and have spoken before me. And in the with the aim that our junior colleagues can just refer to this presentation and take off, use it as a sort of a checklist for their travel with any international sports team. Okay. So the traveling sports physician, it is always a considerable challenge traveling with a team. It is never glamorous. Yes, despite all the photographs and other things shared on social media, I don't think there's anything glamorous about it, because providing quality medical support to an international team is always stressful and it is very, very exhausting. It's a 24/7 job and it requires far more than good professional and medical skills. What are the peculiarities of being an international sports physician? Your working hours are long. The working conditions are very, I would say, less than ideal. You're always dealing with people who are under great stress due to their competition and the travel. There is an extended absence from family and work. You need careful preparation. You will be working long hours and you will be developing multiple treatment skills. You may not be practicing sports medicine per se, only sports medicine per se. You will maybe need to treat an appendix. You will maybe able to treat a diarrhea. So you will be developing multiple treatment skills. And you should have well developed interpersonal skills, and for your own well-being and sanity, your personal coping mechanism should be well developed. As Dr. Ahuja, Dr. Ken, and Colonel Rajesh have mentioned earlier, you should be prepared to play several roles. You will be a physician, you will be a physiotherapist, you will be a massage therapist, you will have to perform podiatry, you will have to perform training, you will be a fitness advisor, you will be a dietitian, you will have to act as a psychologist. Sometimes you work as an assistant team manager, sometimes you work as an assistant coach. You will have to perform duties as a statistician. You will be coordinating travel most of the time, because definitely several times you will find yourself as the only person who can speak English or any other foreign language. You will be supervising baggage, and you will also act as a biomechanist and or video analyst. Before you leave the country or before you get attached to any team, it is imperative that you get several attitude adjustments done. Number one, your attitude and your demeanor should always be confidence inspiring and positive. You should never speak a negative word. You should never behave in a negative manner. When you take on the duties of a team physician, you are the team physician of the Indian boxing team or the Indian hockey team or the Indian Olympic team only. You may be a colonel, you may be a commandant, you may be a whatever rank or whatever position, you may be a professor, you may whatever position or rank you're holding in your normal day-to-day life, please leave that behind when you leave home. You will function only as the team physician of so-and-so team, full stop, period. Please obey all the local laws and customs of the country you're going to. Respect their traditions and be mindful of them, be aware of them, and try not to insult them or unknowingly. Try and be polite with everybody you meet. Try not to show attitude, but yes, where it is required, a polite but firm attitude always gets results. Whenever you're traveling in a foreign country, whoever you meet, make sure you greet them good morning, whether he is a porter, whether he is a driver, whether he is whoever you meet. Other countries do not have the Indian, snubbing attitude. They always greet each other irrespective of your rank and position. So whoever you meet, try and wish them good morning. If not, a namaste is fine enough. They appreciate you for it. Whatever you share on social media, always be appropriate. Take permission for sharing photographs. Do not share anything which is insulting or demeaning to the country where you are in, and try not to be overly critical or negative comments should be avoided. Be aware that you, as an Indian boxing team or an Indian cricket team or an Indian hockey team, you will be under increased media scrutiny. So your behavior, demeanor, and attitude at all times should be as befitting ambassadors to your nation. Now, people who are in defense or allied professions, whenever you fill in an application for a visa and whenever you submit your application, your passport for a visa, the host nation knows that you are an armed forces or a police officer or someone working in the defense or the security services of your nation. You will always have more scrutiny than others. So make sure your documentation when you submit it for visa is always correct and appropriate, because invariably it is your passport and visa which is delayed. When you reach the country, you will never be allowed to move around in the host nation without an escort. Now, please do not try and argue with this, or please do not try and move away from the escort or try and lose the escort, because it only increases your headache and your stress unnecessarily. By the very nature of your job and the position you hold in India, you will be under scrutiny by the host nation and their security services. So be aware of this and accept it. Please understand that whether as part of the contingent or as part of the team, you may be a flag bearer or you may not be, but you definitely are flag bearers. You will always be wearing the India flag on your kit, and your kit will always have the name India. So kindly be appropriate in your manner, in your behavior, and in your dressing always. So we come to the pre-travel research, the pre-travel preparations which you're supposed to undertake. Research the travel destination completely, thoroughly, and you should be aware of each and every aspect of the travel destination. Whether you need to have acclimatization to the travel destination, you should be aware of that, and you should advise the Federation to plan the travel accordingly. Look into the team's accommodations and sleeping arrangements. Now, this photograph is of the famous cardboard beds of the Tokyo Olympics. So you should be aware of whether it is single, sharing, or dormitory type sleeping, so that you can plan your team's sleeping arrangements better. Ensure that you have a dedicated medical room always. If a dedicated medical room is not available, make sure that the team doctor's room is always a single room so that it can double up as a medical room. Look into the food and water availability at the hotel and the venue, because these are aspects. If there is about a food poisoning or any other food or waterborne illnesses, that will affect the team performance. Be aware of the vaccination requirements and ensure that all your team members have fulfilled the vaccination requirements and are carrying the required certificates, because a lot of countries have got different vaccine requirements, and in today's COVID scenario, you should have the vaccination certificates and endorsed on your passport also. Assess the medical support services which are available in the host nation, and be aware of any lacunae so that you can fill them up. Make sure all your team members have appropriate travel insurance, and do not leave the country without travel insurance, because it will cause a lot of headaches for you later. There are certain nations which do not accept your medical degree, but for certain events, a waiver is usually given. There is a rowing federation which has got something called licensing for the travel physicians, and which I feel is a very good system and should be followed by all the other federations also. Make sure your accreditation is complete, and not just your accreditation. Make sure the accreditation for your medical team members are also complete. The reason why I say that is the medical team needs something called Infinity accreditation. The Infinity Pass allows you to enter each and every area of the venue, which may not be possible for all the other members of your team. Pre-travel activity. Make sure you attend the camp to meet the athletes and officials. Give sufficient time prior to their departure to join the camp. Perform your pre-participation physical exam and your comprehensive assessments, depending upon which part of the training program they are in, and depending upon whether your input is being sought for team selection or not. Whatever you find in your assessments, please initiate treatment for all the conditions and illnesses you find. If need be, liaise with the player's own treating physician prior to performing your own assessment, so that you're aware of what treatment has been given to your athlete earlier. Get the medical history of injuries, illnesses, and drug therapy for all team members, not just the players. Because the team managers, the coaches, the physiotherapists, the medical staff, the support staff, they are all advanced in age, and they're not young fit people like the team members, and they may require certain medications, certain therapies, certain instruments, certain nebulizers to be carried with you, so that you can they are able to manage their travel better. All injuries prior to departure should be managed appropriately, and I would advise you to be a bit strict and firm with carrying injured athletes along with you to the host country. Whenever you get time, visit the local market and always carry small mementos with you, because invariably at international events, people will be meeting you and they will exchange something from their country. And if you do not have a lapel pin or any other small token of your country with you, it creates an embarrassing picture. So always carry small mementos with you, or small lapel pins or cufflinks or something which which showcases India. Always conduct a medical briefing prior to your team departure. This is very important. In case you are able to print handouts, or you can able to send emails prior to departure, please do so. It should always be followed up by a team or individual discussions prior to departure. Your medical briefing should include how to cope with air travel and jet lag. What should be the diet you should be taking? How will you acclimatize to the heat conditions, to the cold, to the altitude, or whatever at the location? Your briefing should include anti-doping precautions and anti-doping procedures. You should always be briefing the athletes about permissible drugs, permissible medicines, whether or not the use of alcohol is permitted. And please brief your athletes about safe sexual practices and ensure that you carry condoms and female condoms in your kit. Brief the athletes about the medical capabilities which you are carrying and which you are able to perform and what are your team responsibilities. The physician's kit. This can vary. There are several ideas and several lists for physician kits available in one of our textbooks also about sports medicine. Each sport has got a different physician kit which is mandatory. It depends on your medical support team, whether you have a physio, whether you have a masseur, whether you're the only doctor traveling with the team. Depends upon the team size, it depends upon the destination, and it depends upon the local facilities which are available. My only advice to you is be as self-sufficient as possible because obtaining equipment and drugs abroad is very difficult, time consuming, and very, very expensive. In some cases, your medical license is not valid in that country. You may not be able to procure even a paracetamol. So always carry everything but the kitchen sink with you, and if you can, throw the kitchen sink also in your kit. Whatever supplements your team members are taking, please check them, please verify them, and assure yourself and the team members that they are dope-free supplements, and do not allow any doubtful supplements to be carried by the team. Your main kit generally goes in your checked-in baggage, and your travel kit goes on to your hip pouch. Make sure you're carrying a travel kit, otherwise you will have problems if there is an emergency on board the flight. Okay, air travel and jet lag. Arrange for minimal stopover flights. Wherever possible, try and use a direct flight. I know this is easier said than done because you do not generally book your flights. The travel agents book it and they always try and look for the cheapest possible option. But wherever possible, try and arrange for a direct flight. If there is a stopover, try and make it as small as possible. If you can, plan your arrival so that you arrive late afternoon or early evening. 4 days prior to your departure, adjust your eating, sleeping, and training times as per your destination. Whenever you start the trip, set your watch and routine to destination time and plan your activities during the travel to whatever is the time at the destination. If you are arriving in the morning, sleep before your arrival, immediately before your arrival on the flight, so that when you arrive in the morning, you are fresh and you can get through the whole day immediately after arrival and sleep at the routine time during your routine local time. If you're arriving in the evening, try not to sleep in the immediate hours preceding to your arrival. Try to sleep much earlier so that when you arrive, you are awake. You have not slept for at least 6 to 8 hours prior to your arrival. You arrive at a decent time, get through the day, and sleep at the normal sleeping time of the local sleep of the destination time so that you minimize your jet lag. Whenever you're traveling with a team, liaise with the airport and the Indian embassy because invariably the Indian team travels economy class. So when you're traveling economy class, you're not allowed to use the airport lounge. So what you do as the team doctor, as a defense officer, or as a team senior, go and speak to the airport guys, go and speak to the embassy guys. Usually, if you say I'm traveling with the Indian boxing team, they will allow you to use the airport lounge, which is a quieter area where you can rest, where you can eat, where you can have some privacy. and they will allow you to use the immigration and customs clearance on priority, so that you're not wasting time standing in line, and you're not wasting time waiting for your immigration, waiting for your customs. When you're on board the aircraft, you try for a preferred seat for everybody. Try and get them their preferred seat which they want, so that they are as rested as possible. Avoid boredom carrying your iPad, carrying your mobile phone, carrying your iPods, whatever floats your boat. However you want to relax during your travel, please do so, and make sure you're carrying them. Carrying a book if required. Be as active as possible during the flight. Walk around, stretch, jog if you want, so that you are not reaching a travel destination without any physical activity. Walking around and drinking as much fluid as possible always helps to minimize the risk of deep vein thrombosis also. Carry some snacks and fruit, because the meals which are served on board an aircraft may not be suitable for you or may not be of your choice. Make sure you have regular fluid intake to avoid dehydration, and avoid caffeine and alcohol on board an aircraft. A simple way to check this is something called a P chart. Tell them that the urine should be as colorless as possible. Make sure your athletes and you are as chill and relaxed while you're traveling. As soon as you arrive at a local with a destination, adopt the local time and try and adopt the food habits of the destination, because as always, eat local, because local food is always hot, freshly prepared and hygienic usually. Whenever you have reached your destination, take your team out for a bout of moderate exercise in the sunlight, so that they are better used to acclimatize to the weather and to the sun, so that they do not have jet lag. Okay, diet. Maintain good dietary practices while traveling. Advise the athlete to always stick to their diet plan. You should be aware of food restrictions and allergies, and while traveling, try and stick to international fast food chains, KFC, McDonald's, Burger King, because their food hygiene standards are usually better than the local places where you can eat. Advise your players not to overeat at buffets, and if your players are tapering down, tell them to watch their carbohydrate intake. Maintain the macro and micronutrient intake, maintain an adequate fluid intake, and tell them to avoid tap water and ice because of the risk of waterborne injury, waterborne diseases. Maintain hand wash hygiene always, and tell them to eat hot food only. Avoid shellfish, salads, unpasteurized milk products, and unpeeled fruits. Tell them to limit alcohol, and tell them to always ask for bottled water or sports drink, and tell them to check the seal of the drinks before they consume the drinks. Always at a venue, visit the kitchen and talk to the chefs. Usually you will find that if you give some importance to the chefs, you will start getting more Indian food, more variety in your food, and better quality of food. So make sure you have that, you spend that little time with the chef and give him some importance. And always when you consume food, look for fresh and recently cooked food. Medical care at the venue. Establish your medical team a medical room as soon as possible. Print out your medical treatment times and keep them on the door and circulate them to your team. Have a good liaison with your local medical personnel and the local referral centers also. You may need to refer a patient, and so that you should know which center to refer the patient to and what facilities are available there. All treatment of injuries and illnesses from your end should be aggressive. No wait and watch technique should be adopted. Start treatment quickly and start treatment aggressively. Emergency contact numbers should be available with all the players and at the venue possible. Try and carry a portable massage table, because if it is not available, if examination beds are not available, a portable massage table can double up as a good examination couch and treatment couch also. Make sure your attitude is always positive and supportive towards all the team members and the other teams also. Make sure you are able to take up any leadership roles as required by your team, because certain cases your coaches and your managers may not be familiar with the local language and customs which you as a more educated doctor may be familiar with. You will always be asked to give medical care to other teams or to competition venues. Like if you're going with a boxing team, you may be asked to perform duties as ringside physician. So please do so graciously. When you're giving medical care to other teams, make sure you tell them to check with their local doctor once they reach the home country and give them a proper prescription and a treatment summary so that their local doctor can follow up with them later once they reach their home country. Always, as a medical legal case, make sure you tell them that your license to practice is valid only in India and you are giving them treatment as a humanitarian gesture only. Anti-doping. Be aware of the WADA code. It is mandatory. Drug testing is mandatory during most competitions. Make sure your team does not ingest any drug, supplement, or food without your clearance. Conduct a proper briefing about sample collection. Always be present during sample collection whenever your athlete is being sample tested. If only, number one reason is morale boosting for the athlete. Number two, you are aware of all sample testing procedures and you will be able to pick up deficiencies, if any, in the sample collection procedures. If you find any deficiency in the sample collection procedure, make sure you note it down and endorse it on the sample collection form as the athlete representative. Always have a prior liaison and a good liaison with the venue anti-doping staff. Post-event, celebrate with your team or commensurate with your team as the condition may be. Maintain and submit documentation regarding all illnesses and injuries to the federation once you come back. All support personnel who have come into contact with you, make sure you give them small mementos or tokens of your stay. Use this opportunity to visit local sports medicine facilities or training facilities so that you are aware of what is available and what the other nations are doing in your field and in the sports arenas. Make sure you visit the local places and shop as much as your wallet allows. Try not to shop where the airport duty free is, because they are usually horribly expensive and they will your wallet will take a very serious hit if you shop during at duty frees only. So visit the local places, imbibe the culture, absorb the culture, and shop to your heart's content. Whenever you come back to your country, submit a detailed after action report to the federation or to the Olympic Association as applicable. Maintain a contact diary for any issues post event. Somebody drops his mobile phone, leaves his mobile phone at the hotel. Somebody leaves some stuff at the venue. You have left some stuff at the venue. Somebody misplaces passport. So you should have all the contact numbers available for any post-event contact eventualities. And when you are traveling back, maintain the same travel discipline which you had maintained while going to the competition. So what are the take-home messages? So traveling with an international sports team is a unique event and it's a unique experience. Pre-planning will minimize your headaches during travel and the event. Be as self-sufficient as possible in terms of medical supplies. Maintain discipline during travel to avoid jet lag. Maintain food, water, and sleep hygiene during every aspect of travel. Be aware of the anti-doping rules. Maintain a medical management plan and enjoy the experience. These are my references, unless were quoted on the slide. I seem to have finished, ladies and gentlemen. Thank you very much for your time, patience, and your patient listening.
Thank you so much, sir. Thank you for such a wonderful, comprehensive talk, as usual, with carrying on. We have two questions which are being raised. One is, he had asked you guidance on the use of melatonin if required for jet lag and sleep.
Yes. Melatonin, even though it is not a banned substance per se under the Anti-Doping Act, wherever possible, try and use natural methods to combat jet lag and try and avoid use of any pharmacotherapeutic agents for combating jet lag and for inducing sleep. I understand that it may not be always possible for the teams to have acclimatization times at the venue, and in such cases, if required, you may use them, but personally, I would advise use natural methods only.
There's one more question from Dr. Barun, sir. I quote him, excellent and comprehensive talk, including all the important points and the practical tips. But doctor, how do you see a sportsman doctor in the role of a team doctor? Unique contribution he or she can give as a doctor of other specialty. All traveling team must be accompanied by sports medicine doctor. What's your thought on the current practice in India?
Okay. Any team, whether amateur, professional, services, national, international, should have a sports medicine doctor only. Period. The unique combination of skill, training, and knowledge which we bring to the table, no other specialty can do that. And if you ask me, we do not try and encroach upon other specialties. We do not enter hospitals and try to do cardiology. We do not enter hospitals and start to do orthopedics. We do not enter hospitals and try to do neurology. So I don't see any reason why any other specialty physician should come into our specialty and encroach upon our areas of expertise. So any sporting event or sports team where the word sports come into, there the physician accompanying the team or covering the event should be a sports physician, period.
Right, sir. Thank you, sir. Thank you for views. And thank you for your presence during the webinar today, sir. Thank you so much.
Thank you.
We have our moving ahead, we have our next speaker, Dr. Gagan Kumar Banodhe, MBBS, DSM, and MD physiologist, to speak on what it means to be a team doctor of Indian boxing team. So I'm happy to invite Dr. Gagan Kumar Banodhe, the treasurer of the Indian Society of Sports and Exercise Medicine, to deliver the next session, what it means to be a team doctor of Indian boxing team. So Dr. Gagan Kumar Banodhe is a medical and clinical physiologist as well as a sports and exercise medicine specialist. After MBBS, graduation in sports medicine from the Netaji Subhash National Institute of Sports, Patiala, and thereafter he went on to do his medical physiology from AIIMS, New Delhi. He has worked as sports medicine specialist in Sports Authority of India, NSNS, Patiala. He has varied experience working with multiple sporting teams, including the Indian senior men boxing team, Indian senior men and women judo team, Indian senior men and women weightlifting team, junior girls. He was posted at Sports Authority of India, Sonipat, as well as that he was posted as medical head at Rajiv Gandhi High Altitude Training Center, Shilaru, Himachal. He has attended the 2014 Glasgow Commonwealth Games, which was held at Scotland, as a team doctor of Indian boxing team. Currently, he is working as senior resident in AIIMS, Raipur, Chhattisgarh. He is currently the treasurer of the ISSEM Society, which is again the only national level registered appellate society by recognized specialist in the field of sports and exercise medicine in the country. He is also a professional tennis player and a lifestyle fitness enthusiast. He has attended numerous national and international conferences. To name a few, he had recently attended the Human Spaceflight Symposium organized by the Indian Space Research Organization, ISRO, the International Academy of Astronautics, and the Astronomical Society of India at Bengaluru. He also has some national and international peer-reviewed and indexed publications to his credit. For the Sunday webinar, sir, over to you to discuss and share your experience and what it means to be a team doctor of Indian boxing team.
Thank you, Chandrasekhar. First of all, I wanted to thank the team who was working day and night to do this today. And also wanted to thank our seniors like Ahuja sir, Anup sir, Adhau sir, Ken sir for enlightening us with a lot of information for team travel in international events. So thank you very much, sir. And I just wanted to say that I did after sports medicine, I did from NS Patiala. I worked there. I worked with various teams, and I had some of my own experiences. So I like to share those experiences with you all. And basically, my presentation is for new doctors who are joining the team or who have joined the team. So what to do basically with the teams? Okay, so let me share my slide first. I'm sharing it. There is some technical problem in sharing the actually.
The presenter privileges are with you, sir.
Yeah, I know, but I can't share my PPT right now. So I'll try to share entire screen so that you can all see the my screen. Okay, I'll try to share it.
Yeah, we could see.
Yeah. Okay. So can you all see the PPT now?
Yes, sir. Yes, sir. We could see.
Okay. Thank you all. So my topic of presentation is like what it means to be a team doctor of Indian boxing team. And so after doing my sports medicine diploma, I worked in Sai for 2 years, and majorly I was associated with Indian boxing team. I worked with them, and I worked with the like at pre-competition phase, then went to the Commonwealth Games 2014, and post-competition I have seen them recovered. So I will highlight some important points regarding this team so that it will give you like a basis for new sports medicine doctors. What can you do with a team? So let's say first of all I'll highlight something like if you can see these three guys and 8 guys went to Commonwealth Games, and these three guys won the medal over there. They reached the final and lost the bout, but they won the silver medal over there. Okay, Mandeep Jangra in 69 kg, then Vijender, and then Devendro. So these three guys won the medal over there. So what was so important about them was first and foremost thing, if you understand, they were injured free. They were injury free. Okay, while heading towards the competition, they didn't have any injury. They were not recovering from any injury. Otherwise, if you see other people, Sangeet Sangwan, Sumit Sangwan, Manoj Kumar, and Amritpreet Singh, they were recovering from the injuries. So that's why that was the main reason they didn't perform well and didn't get the medals. So that's where our role comes. Our role comes like how we prepare them for competition. Okay. So in the next slide, we can see what is our aim. You are a sports medicine doctor, you are associated with a team. What is your aim? As a sports medicine doctor, you are result oriented. Okay, you want results. You are going to a competition. You want results. You want medals. But as you see, I have done MD also after that in physiology, and I am very much. Why did I MD? Because I was very much interested in research. So you can do research also, like exercise physiology. Huh? So when I was there in NIS Patiala, I got the chance to visit Sai Center, Bangalore, and I learned a lot of research techniques over there, like Ahuja sir and Anup sir has shared. We can measure lactate threshold, we can measure the VO2 max and all. So, uh, so I want to tell the new doctors that when you are associated with a team, your aim is result oriented, but along with that, you can do some research because the data of Indian athletes are very less. So what can you do? What can be your focus? So like there are different phases, and which comes under the periodization. Like periodization means the peak comes at around competition. So what can you do at those times, like in pre-competition and post-competition? So first of all, take all the data, whatever is possible. है ना? You are you are you are working with a team, like I was working with boxing team. So there was a designated room over there, separate room, which I used to examine the players, boxers. I examined them separately who were injured, and also taking some data because a punch sensor was kept there. So there was a different room. So I used that room. And when I was associated with them, I used that room for examining and also other things, collecting these data. So what are the important things which can lead to a better sports performance? Like hydration should be maintained. As you all know, in these weight categories, the games which are related with the weight categories, to reduce weight, these guys dehydrate themselves. Okay, but I'll tell you in later slide also. But if you are dehydrated, your performance also reduced. So you have to see the hydration status. Okay. Then of course you are a doctor. A lot of players will be injured because it is a contact sport. Boxing is a contact sport. A lot of people will be injured. You have to manage. You are a medical head. You have a team with you. There will be, like when I was there in Patiala, I had two physios under me and two masseur. So I used to guide them, and I used to guide them to focus on like what to do. You have to guide them. This is a medical team, and you have to work in a collaboration. You are a team. Okay, you are a team with the physios and masseur. You have to work and guide them what to do. Okay, it is not like that they are doing themselves what they think is best and it will produce the results. It is not like that. You have to guide them. Now make charts, take the data, make profile of each player, have profile of each player, and day by day progression you can see. Okay, like hydration status. How can you see the hydration status of a boxer? Just pre-bout, post-bout. See the weight. In the weight difference will be the water loss. Whatever water has been lost. So hydration status. Maintain that. So injury profile, maintain that. Rehabilitation. Then psychological boost. I'll talk about punch sensor. Because I'll tell you, when I was in Patiala, a psychologist was associated with us for a shorter period of time. She came over there and gave us some music, and and she specifically told that to play that music during the bouts and during the training session. So it will give you a psychological boost. Like, have you heard the music of that Rocky, the movie, famous movie Rocky? So just listen to that music and try to work out. It will give you a psychological boost. You will feel well. So same type of music was provided to us for a psychological boost. So this is all done during the training sessions, pre-competition. And then during competition, you have to maintain hydration to be injury free. You have to prevent injuries. So in boxing, lot of petroleum jellies are used. I'll show you the pictures also, like which one is used in Glasgow 2014. And then I used some skin glue to treat a small cuts while maintaining the aseptic precautions. Then for recovery part, I followed each player that, because we didn't take measure with us. So I followed each player that they should get the massage, the recovery massage after the competition or training sessions, because it was provided in the games village. So I was making sure that each and every player was getting it. And side by side, we were doing the rehabilitation part, because 3 of the players were injured. I'll talk about them. Then post competition, again we will reduce the intensity, training intensity, and try to maintain, okay, the whatever it is. And again, same periodization cycle will start for a new competition. Like at that time in 2014, Commonwealth Games were there. After that, Asian Games were there. So there is a change. Okay. So this you have to talk with your coaches. Okay. So this is the focus. Okay. 1 second. Okay. So as I was telling you, what you can do in pre-competition as a sportsmanship doctor, if you wanna do research, you can take all the data, whatever you can, and then as a sportsmanship doctor, to keep them injury free, maintain the injury profile of each athlete. And look the hydration status, see the weight. That is the easiest thing you can do. And look at the training. They are doing proper warm up, cool down, and recovery or not. Because you all know that proper warm up and cool down is essential for injury free performance. And this doping thing and all, everyone has always used to tell that, ask them not to take anything from outside, whatever Ayurvedic treatments, supplements, it can lead to doping. Okay, so let's take them one by one. I will highlight some boxers now. Like this Manoj Kumar, he was the gold medalist in 64 kg 2020. But during the common preparation of Commonwealth Games, he had some hamstring issues, and recovering well and performed well during the competition also. But somehow he used to get injured during the competition. Like he had a chest injury during Commonwealth game, then had a cut also in one bout, and ultimately lost a bout, and didn't get any medal. But later on, he changed his weight category 2018 and won a medal. Okay, so that was the story. So hamstring strain, and everything is given in all the books you will find. So I just wanted to highlight what are the preventive measures you can take to prevent this hamstring injury. First of all, the flexibility. Flexibility is very important of both. And if hamstring is tight or quadriceps is tight, it will definitely will lead to the hamstring strain. So assess the flexibility of the boxers or whatever athlete you are working, and ask your physiotherapist to assess the flexibility of the boxers. Okay, ask them, assess the athletes. Okay, and flexibility is also affected by hydration status. To assess, daily assess. Okay, and in rehabilitation, we have to do everything, like from stretching, strengthening to everything, to prevent it and treat it. I did everything whatever I could with him. Okay, then next, Sumit Sangwan, as I was telling, during the pre-competition phase, preparatory phase, he fractured his thumb, and then it was treated surgically, rehabilitated properly, and made fit for tournament. And you all should know, and I guess you all know, then you have to file a therapeutic use exemption, because he underwent a surgery and the drugs and everything was used comes under doping. So before going to a competition, immediately, even even before taking the drugs, you have to file this TUE. Okay, it's not like that. If it is an emergency, it is allowed. But like if a doctor prescribes a drug, before taking, you have to file TUE to NADA. Take the permission to take the drug. Okay, you have to file it. Okay, TUE. So I filled the TUE, then he got it, and then he went over there. But maybe he did all the rehabilitation, but again injured during the competition. He lost the bout. Then Shiva Thapa, he was number 3 at that time in his weight category. But his first bout was against a tough guy, that is a number 2 guy, and he lost it and had head injury. Probable, although we assessed for concussion, it was not there. Maybe something else, but the result was like he lost. It was a tough fight. Okay, so these were the injuries I faced pre-competition and competition. Okay, one more guy was there, but these pictures are for basically for strengthening of the fingers. Okay, like first one is the flexion, flexors, extensors, then stretching of the fingers, and then extensor. Last one is the extension of the thumb. So basically strengthening and stretching of fingers. So then next one I wanted to highlight, maybe it is not that much common in boxers, but very much common in runners. So I had a player, his name was Narendra, and he used to fight in around 64 or 69 kg weight. He had that problem since a long time, plantar fasciitis, and he used to tell me, sir, it is recovering, but then again and again recurring. Okay, so I assessed him and specifically asked and rehabilitate him with the help of stretching of plantar fascia and massage, soft tissue therapy, and provided him the silicone gel insole. I asked him to use the silicone gel insole always, and wear it always. And after that, he didn't have that the problem. So it was, we used to tell that, okay, just use the silicone gel insole and follow the therapy. You will definitely recover. And he recovered well. Then shin pain. The Amritpreet Singh, 91 kg category, he had that issue, shin pain. So what we did, I talked with the coach, I talked with the coach to decrease the intensity of his training pre-competition. Okay, and also asked him to do specific exercise of lower legs like calf raises for strengthening of the calf. So you have to strengthen. Okay, if there is anything, then you have to strengthen the muscle like calf raises. So I asked him specifically to do the calf raises, and then assessment and all, all what are aggravating and relieving factors, and you can assess stress fracture. If it is, then there are multiple investigation you can do, and simplest is the tuning fork test. With the help of tuning fork, just vibrate it, put on the bony prominence. If it feels pain, then maybe there is a fracture, stress fracture. So that is the simplest. Otherwise, you can go the scans also. But he didn't have that, only the pain. We decreased the intensity and asked him to do the exercise, strengthening exercise, and he got well. Okay, so these were the some of my experiences I had during the competition and then during the competition. Okay, then this punch. I think right now he's in Olympics, so he knows well. And Amol also has worked with boxers, so he knows. There is a punch sensor in a separate room, and this punch sensor used to detect the frequency of the punches and also the force of the punches hit by the boxers. So before me, a lot of doctors were there, worked there, and they used that, and the data were there. But at the time of CWG, the coach specifically asked me, do something so that we can show them that because of this training, we have increased your punch force and frequency. So I manipulated some data and asked the boxers to punch on that punch sensor. Okay, it was a square shaped punching equipment. I asked them to punch, okay, for 5 seconds, and then shown him the data. Like, this was your previous data, and this is now the data which has improved, which has shown that improved data. Okay, like force was improved, and also the frequency, punches per second, have improved. So this basically gave them the psychological boost. That was the psychological boost, nothing else. And I didn't do anything much with that after that, but that was the psychological boost I used. Okay, so psychology is very important. And if you are associated with a team, talk with your boxers, talk with your team, talk with your athletes, and give them that psychological boost that, okay, you can do it. Like, I remember a story, I remember this thing, even like, there was a boxer who had some issues, who had some problems with family problems. At the time of event, he was very disturbed. But I had a session with him, counseled him, and told him that, no, don't worry about that. Okay, focus on your training and you will do well. And afterwards, he did well. He won the medal for the India. So that was very well. So you see, you are a doctor, you are a psychologist, and sometimes, as sir already told, you have to act as a physiotherapist and masseur. So don't worry about that. And you are a medical head. You can be everything, and also you have to guide everyone. Then Games Village, Ken sir has already talked about, and Anup sir and Ahuja sir has already talked about, like, what you all needed to go to a competition. That like, I went to CWG at Glasgow. So first I did my GMC registration over there. Then when I went there, okay, then after disclosing all my medicine at arrival at there in Games Village, I got my prescription sheet after showing the registration, where I can actually I can write the medicine to the athlete. So these were all needed to you, and while you are in Game Village. Okay. Then Kane sir specifically asked the question about the jet lag. So a little bit about the jet lag. When you travel a long duration flight which crosses more number of time zones, like more number of time zone shifts are there, and more pronounced on east side. If you are traveling eastern, it is more pronounced, and it can lead to the sleep deprivation and stress, and dehydration and all. It can lead to that. So to prevent jet lag, you have to be prepared for it. If you are a team doctor and you are working with a team and you are traveling, you should know how to prevent it. Okay, like, how to prevent the dehydration. Like, in-flight options are there. Like, you can opt for low salt, low fat vegetarian diet. It will help you in preventing dehydration. And drugs you can prescribe, like melatonin is not a banned drug, but as sir said, I will also say, reduce the amount of medication you use. Okay, reduce it. Try to prevent with other things, and also, like sir said, naturally, be in sunlight more, so that circadian rhythm will be reset, as Anup sir said. And also, with the help of physical activity during the daytime and spend outdoor at sunlight, will basically reset your circadian rhythm. It will help you out with fighting the jet lag. Then about the hydration status, as I was telling, very important. Hydration, if you are dehydrated, for first of all, you will be prone to injury, and also it will decrease the performance. And it has been already seen in literature that even the 3 to 4% of body weight reduction can lead to weight loss of 3 to 4% of body weight can lead to decrease in performance. And how can you see hydration status? As I already told, it can be seen with the help of body weight and urine color. Okay, and then if you talk about sports drink, it should be carbohydrate drinks, and content of the sodium will help you maintaining the hydration. Okay, then very important thing is pre-event meal. It should be light and easily digested food, and a timing early meal you should take. You should ask your athlete to follow these, and high in carbohydrate and low in fat and fiber. This was I wanted to tell you all. Like research was going on there in Commonwealth Games, and they were using this jelly to see that these petroleum jellies are preventing the cuts in boxer or not. So I took this picture and bring some sample also to use in my boxers also. Okay, so this was Cavilon jelly they were using at that time. This is the RG High Altitude Center, Shilaru, where I worked with various teams. Like I worked with Indian weightlifting team. So this is Mirabai Chanu. Congratulations to all. She won silver in Olympic. So I worked with her at that time. She was suffering from costochondritis. So I treated her and she did well. Then this was the Indian judo team. I highlighted the boxer in white t-shirt, that is the Susila, which qualified for this time judo for Olympics, and the coach is there like Jeevan sir. He is the most efficient coach in judo right now in India. So this is the and about this is about what I told to new sports medicine doctor, like take the data, follow up your athletes, and assess psychological issues. You are a medical head to coordinate well with everyone, and you should have your medical bag always ready. Okay, this is with Kane sir in Delhi UWW Championship. Kane sir, Barun, and UWW doctor. Okay, we had a small meeting over there, yeah, and covered this event. Then remembering Khante sir, we lost him just recently, so just this PPT dedicated to him. Okay, he was a very good guy and a very good sports medicine doctor from Mizoram. So just remembering him. Thank you everyone for giving me time. Thank you ISSEM. Thank you Deepak and Guru and Asha to make this happen. I'm just stopping the sharing my PPT. Thank you very much. Thank you. Thank you much.
Thank you so much, sir. Thank you for
I'll stop sharing.
Thank you, sir. Thank you for the case studies and the way you approach these as a team doctor. To provide the research aspect the team doctor must possess. I hope the audience would have gained some clinical knowledge from the talk. We have few queries, sir. One question is, we got it from the YouTube chat. This is from Mr. Vishnu Madatil. He is asking, can you explain what Tanita body mass analyzer is and how it is different to other anthropometric measurements available?
Okay. I didn't mention it in my talk, but it is in PPT. Like, see, first of all, it is not different from other body mass analyzer. It is also a bioimpedance analyzer, but it is more accurate. And if you search in literature, it is a Japanese brand and it is mentioned everywhere. So when you are doing a research work, you wanted equipment which are being used by other professionals and which is more authentic. So that's why we use Tanita body mass analyzer, because it is being already used, produce results, and more authentic. That's it.
And from our society president, Dr. Barun, he asked, what is your advice when you're in conflict about a decision between you and the coach as a team doctor? How do you resolve such conflict, especially which is related to health issue of players and their performance?
I straight away ask for rest. See, I don't go by the advice of coaches. If you want a different doctor's opinion, that's all right. You can take opinions of everyone, and I'm open to that. But if a coach asks me for my opinion, I will tell him whatever is right for the athlete. And I straight away tell that if you want to consult anyone else, you can consult. No issue with me. No problem.
Right, sir. And one more question is, asked, can you give some non-medical service which as a sports medicine doctor can provide to his players and the team so that overall health and performance of the team increase?
Yeah, non-medical means like you can be as a team manager, right? You can act as a team manager, because see, maybe you don't have a manager and you have to manage everything. And I'll tell you, when I was in Commonwealth Games village, I used to manage my boxers. I used to take them from the games village to the boxing arena. That is the competitions is occurring at a different venue, so I used to take them there. And one time what happened, a boxer lost his accreditation card, so he was not getting है ना, the getting the he was not able to get inside the arena. So he called me. I was in village. I took his accreditation card and took the bus which was provided by the village, and went there and gave him the card so that he can get inside and go and just have a bout. So these are all the things you can do apart from the medical facility.
Right, sir. Thank you so much. Okay, a wonderful session that you had provided. And going ahead, with the next session, we have good news coming from Tokyo. I think we have our Maricom has won a boat and got qualified for the round of 16. So that's very good news. And going ahead with our next speaker, who has been associated with the boxing team for the past 5 years. So we have Dr. Amol. He's going to first eye view of sports physicians view in a multi-sport event. So introducing him to you all, Dr. Amol Patil has done his graduation from Grant Medical College, Mumbai, where he was actively involved into activities under GMC Gymkhana. During his undergraduate days, he had represented Grant Medical at All India Inter-University swimming tournaments. Further, he has done post-graduation in sports medicine from the Netaji Subhash National Institute of Sports, Patiala. He's also done diploma in drug and sports and many such certifications. Dr. Amol was associated with the Indian boxing team, as I mentioned earlier, for the past 5 years. Until recently, he had resigned to start his new venture of running sports science educational courses under Sports Next Institute. He was the team doctor for many international tournaments, including the Asian and World Boxing Championships. Also, he was a contingent doctor for the 2018 Commonwealth Games, which happened at Gold Coast, Australia. He worked as ringside doctor for Big Board Indian Boxing League and has also worked as sports medicine doctor for covering events, kabaddi, gymnastics, wrestling, etc. He is working as honorary consultant to Ministry of Youth Affairs and Sports Vision Olympic Cell for extending better sports science support to target Olympic podium scheme athletes. And he was the principal architect of the Central Athlete Injury Management Scheme that was recently launched by the ministry. Holding you up, I welcome Dr. Amol, the last speaker for the webinar today, on behalf of the ISSEM team, to share his views and enlighten us on the topic that he has chosen. Over to you, sir.
Thank you, Dr. Guru, for a wonderful introduction. Good afternoon to all, and I think we have well past the lunch time. Will not take much time to complete my presentation today on the sports physician's bird's eye view, sharing my experiences as a team physician when I worked with the Indian boxing team, and also help some of the athletes from cycling, gymnastics, and wrestling at IG Stadium. A very good news I just had. I was actually juggling between the windows to see Mary's bout, but couldn't see it because my presentation was lined up next. Anyways, I'm happy that she has won and moved to the next, round. Although all of my seniors who have been there today have expressed their views and given us a valuable insight, covering almost all the aspects of a team physician. There is not much to say for me, but nevertheless, I would like to express some of my views, my personal opinions, I would say, that I feel that I need to be shared for the younger generations who are looking up sports medicine as a career option. So my journey with the team, with the boxing team, was a short span of 5 years. I was very lucky to have been associated as a team doctor and as a ringside doctor for majority of the tournaments. The 2018 Commonwealth Games was the game changer for me. 2019 Big Bout Indian Boxing League was another big event that marked the professional league in the in my career as a ringside doctor after my IBA certification. 18-19 IBA Women's World Championship. I had a lot of personal challenges in terms of handling team regarding the injuries and getting those boxers fit for the tournaments and then getting medals out of them. So it was a challenging journey in those years. Asian championships and many more championships. So not taking much more time, just moving on to the next slide. Yes, 2016 was a decision that changed my life. I started, I chose to be with the team. Initially, I was planning to have an academic career, wanted to be into completing my PhD and everything. I enrolled for it, worked for 6 months in one of the university, and just left it because Mr. Sandhu, most of you might be knowing, the chief coach of boxing then, he forcefully brought me into the team and then said, "You're missing a big chance in your life, and you should actually try out your career here because that will change your life." And truly, to his advice, I would say, or forceful thing, I entered boxing. I never wanted to be into boxing. Honestly, if you would have asked me in 2016 June, I would have never been, interested into the game of boxing. But this destiny had a different thing for me. I started loving the sport and I entered into the as a team doctor. Since then, the journey was quite good. There were ups and downs, and I was learning at each time with passing experiences. Most important thing that I would like to share here was the year 2018, which was a transition in my career because I got an opportunity to represent India as at the Commonwealth Games. And believe me, that was, I had worked hard, but I know uh, people work for years together and they don't get even chance to represent the country at the games, specifically games. I was very lucky that in the initial, initial years of my career, I was chosen for this important, games, and that altogether changed my perspective towards being the team physician and all. Uh, to begin with, the journey was like it was so rapid. The changes were happening so rapid that on something around, I remember it was some night of 9th of March. I was told that okay, you're supposed to be going to Commonwealth Games, and you have to make everything ready. The team was supposed to leave on 15th March. So, imagine my state of affairs on 9th of March. I'm being told that, yes, you are going to represent India, Indian boxing team as a team doctor, and you're going to Gold Coast. Nothing is ready, nothing. The right from the ceremonial kit to all those things, everything is happening all of a sudden. It's Sunday, and I'm being rushed from one place to another and gathering my things together. I didn't have my kit ready because I was not hoping that I will be chosen for that thing. So all last moment changes and all, and finally, the day came. I left for the Gold Coast, and things are different. When I landed in Gold Coast, I came to know that yes, we have some problem with the accreditation of another doctor who is not unfortunately coming. Unfortunately, we lost him late. Dr. Mendirata sir. So he was not able to come that time, and then your accreditation is being promoted to infinity. You are now the contingent doctor, and you have to manage everything. So I had a very less experience. I was very young. I'm still the youngest, I think, all the speakers today, with a very less experience that time, and shouldered with a big responsibility, and I was looking at, yes, now what am I going to do? This is my first games, and I have to find a way. So luckily, I was supported by a lot of good people around me who were always guiding me, and the journey was, I won't say an easy one, but a good learning curve for me. Various events happened, and we sailed through it, some good, some bad, but there are sweet memories, I would say, that has left imprints on my mind. As a team doctor, can see some of the photographs. They are from the, I think the flag bearer is from the closing ceremony. Mary is holding the flag. We, along with my medical team at the opening ceremony, this was a cultural night in the Gold Coast, which is typically there. And I'm sure Rajiv sir must be cherishing that, evenings, parties and all at the games, because it's altogether a different, scene once the games are over, and in the night everybody is there for recreation and everybody forgets their enmity and all put their hands together, starts rejoicing. That's a different thing. I think most of the people would be missing this time in Tokyo because of the restrictions of COVID. But the games are itself a different experiences. One should actually go there to experience those things, because those are something which you will remember for your life. That will be a game changer. Just to put on some things that I would like for the junior people to remember in their life, that you should always have a checklist ready, because what I struggled that time was my kit was disorganized and everything had to be last moment packing and everything, because I was ill informed that time, and in the initial days. So then later on, I had a habit made that, okay, my checklist is always there. So even if I have a less time to pack my things and all, I just look at my checklist and just put on those things so that I don't miss out important things. And if you really don't have one, you should be making it ready today itself, because that will save you from a lot of troubles. So that checklist has to be there with each of the physician who is intending to travel with the team. Sorry, I think, yeah, good. So the next thing is the important thing that I learned over a period when I was in the games village. That is the detailed whereabouts during the games. Something this is Keen sir must have. I mean, he has highlighted a part of whereabout and all, because he's into active management of those doping thing from ITA. But what I learned is you have to give a whereabout for each day in the village. And believe me, it looks very simple, but it's a big challenge, because your training time and everything has to be entered, and that has to be given one day prior, at least 24 hours prior, for the in competition sampling to be done wherever it is required. And our Indians, they don't have the plans which are ready for them, training plans and all. They just work at whims and fancies. So sometimes they may have a training at 7 o'clock in the morning. The next day they might shift the training to 9 o'clock, and the training venue is different. The villages are different place. So you may have discrepancy in your whereabouts, and that can seriously create issues and may land you into huge punishment for defaulters. And this is one thing, as a team doctor, you should have a responsibility that plan the thing well in advance before you go with the coach, discuss it that, yes, this is the problem and we have to deal with it. This is the requirement of the time, and detailed whereabouts have to be planned out. So just miss the 60-minute window has to be planned each day, and you have to be there at that time, because violating that will create huge problems. We have faced one issues, and believe me, it was very difficult for us to get out of it, in spite of being innocent on that matters. No needle policy, again, an important thing which all physicians should be knowing about it, read about it. Each game has its own no needle policy and its implications. Overall, the policy is same, that you cannot have a needle practiced in the games village or when the event starts in that particular country. But it is not like that. As a physician, if you want to use any intravenous drug or intramuscular injection, that has to be declared. So no needle policy is not about a doctor not using it. It is about the judicious use by a doctor when needed, when indicated, supported by evidence, and the most important thing, followed by a declaration within the 6 hours time after use. And this is something which each of you should keep in your mind right now, because it will save horror in future if you ever fall to it. Because getting out of this declaration defaulter is a very big task, and believe me, you can land into a lot of problems as a doctor. The best way I would say is just take your athlete to the village polyclinic and administer what you want, because that, number one, everything is available there. Number two, everything is being assisted there, so you have a lot of assisting staff with you. Number three, every record is available there, so once you enter into polyclinic record, you don't have to do something separate in that. And this is something which I learned with my personal experiences, that rather than taking your own call at village itself in one of the athletes' room, it's always good that if you can carry the person to the just walk them to the village, because it's not very far away. It's just some few meters distance away from your residence, and you can just walk into the village polyclinic, introduce yourself as a team doctor, use your prescription, just like Gagan sir highlighted that you are issued your prescription and prescription pad once you arrive at the village and all. Use your stamp and just maintain the records that you have. Not going much into details, we'll discuss some other day if you really are interested into it. Daily injury and illness records, Kane sir has already highlighted it, and it is a need of time. You should always have the records ready. They should be updated every day. At the evening, there is a particular time for each of the games. They have their own policy. It has to be declared to either a contingent doctor. If you are a team doctor, you have to declare it to the contingent doctor of the NOC, that is National Olympic Committee, or in this case, India. And if you are the contingent doctor, then you are supposed to be delivering it to the venue medical correspondent or somebody who is interested with that responsibility from the local organizing committee from the medical side. So one advice that not really an advice, something that I would share as an opinion, that you should always declare voluntarily whatever has happened, whatever treatment you have given, whatever information you have, true, and complete it and just update it every day, because that will create the logs which are mandatory, that can save you from a lot of trouble in the case of any investigation which is there, and that will save you to save your everything in future if there are any problems. Coming to the next point is understand the sport, because as a team doctor you should always understand the needs of the sport, and also you should understand the administration requirements, because there are times are problems when you understand the need of the sport but the administration requirements are different, because administration has to look holistically and it has to be looking at the resources which are limited. So you have to find a balance between for these things, and just try to figure out some solution which you think that can be a balance between these things. And you have to be a leader with solutions, not just an person with arguing and complaining about that such a such thing is not being present there, or it's not available. Had I been in my country, this would have been available to me. I'm so and so doctor, I have so and so experience, I have been so and so. So all these things should not be there. You should be compliant, you should be you should be a leader to find out the best out of the least available things or the least resources that you have. And that is something which I learned over a period of time, that yes, that has to be there. So sorry, I don't know what is happening here. This annotation, I didn't click it. Okay, so yeah. So yeah, some of the beautiful memories at CWG when I was at work, handling the cut, the Mary's first gold medal at Commonwealth Games 18 for India, and the enjoying the moment just after the games coming out of the venue. Some of the beautiful memories that regarding the media talk, my personal view, as far as possible, adhere to the media protocol and let the official person from the team speak about it, or if at all there is a team manager assigned to your team, the manager will do the task. But if at all they pokes you and you are supposed to speak on some matters, like as a doctor, as expert, you are about to comment on some of the player, you have to weigh between the the interest of your federation and your team and the career of the person and the things at stake, and then speak out. My personal take would be you just have to speak out the truth when you're asked to, but how much and how to divulge it is an art which cannot be taught, which has to be learned on your own. And in due course of time, you will learn how to disclose the things as you grow experiences and all. So these are some of the wonderful moments from 1920 and 2017 also. I think for the World Championships and Asian Championship and big bout things and all, my teams getting medals and all. I see a lot of when I see these pictures, it's not only the memories. I see a lot of stories that are there in these pictures that has put us in those tough times when we were supposed to take decisions regarding the participation of players, to just making them fit for the competition, then moving on to winning medals, and then returning back, and then facing the post sequelae uh, of all the decisions that we took at that time. Luckily, I was very much supported by my medical team, as Ken sir and Anup sir had told us that the team approach is more important, and you should have a strong team behind you. I was lucky to have a good team of physiotherapists and support staff, and moreover, the coaches that I worked with were really good, had faith in me, so that I could take tougher decisions when it came to us. To share some of the experiences, I would not name the person because of the confidentiality and the things, but I can say you that we had a time when we had one of the person getting a stress fracture, and there was a time that whether we can continue with that particular boxer, and it was a world championship event and we were the host. I mean, India was host. It is 2018 World Championship event, and that is one of the stress factor. Um, we took a decision to let the boxer fight, and that was a conscious decision. The effects are we won a medal in that case. And that was a tough time till the end of the championship, that I couldn't sleep for these days, because I knew somewhere I'm taking risk, somewhere my coach is also taking risk with me. I have explained him, and only two of us know about the real thing. We haven't even disclosed it to the boxer for the better interest, because we wanted medal. And this is where performance thing comes into picture, that you have to take some decisions where performance matters, and what is best for your country, what can fetch you the medal, whatever it takes, whatever cost it takes. It's very easier for you, for us to say that yes, boxers' health, or for that matter, athletes' health first, and we should respect that. We should always give priority to the health, and we should take decisions based on that. But when you actually work for a team, your priorities change. I mean, I have seen with myself, that is again. What I'm saying is my personal opinion. It may differ from people, and I'm really sorry for that if I'm hurting anybody. But it all depends on you, how you deal the situation, how much risk-taking behavior you have, how much you are ready to put in for the team, for that effort, for that medal that you are aiming at, and how much athlete trust in you. And if that goes well, it's well balanced and all, I'm sure you will have wonderful results in your coming years, or on your careers as a team physicians, when you're working with the elite teams. Some of the harsh realities that I would like to point out as a team physician's career. Most important thing these days is your dignity as a sports physician, because of the involvement of a lot of modalities of treatment, a lot of experts, advisors, a lot of cross pathies being practiced in the sports. Indian sports is growing up, the sports sciences and all, everything is support is coming up into the picture. A lot of stakeholders are increasing. Previously, when Rajiv sir, maybe he started his career, only Sai was dominant to have opinion on all these teams and their support staff and their policy to be decided. And Sai doctors holded a very high opinion in terms of practicing. And today is in 2021. I think the reality check. I mean, at least I had some of the instances, and that's why I'm bringing it this topic here. There is a shift from competence and professionality to people pleasing behavior. People are started liking the people pleasing behavior. And to some extent, even we are the victims of that, and that can seriously impair our judgments as team physicians, and can put your your dignity at stake in certain situations. And how to deal with it, that's again an individual question. So the second thing that comes to my mind is what exactly we do last minute by accompanying with the teams at multi-sport events. I mean, why we are talking about that sports physician is absolutely essential with sporting teams in a multi-sport event. What exactly is our role at that moment? Because if you look at from a third person's perspective, um, you know, uh, if somebody XYZ person is accompanying a team with a basic qualification of MBBS and then some other specialization, not sports medicine, I would say, even he's going to provide the first aid. And are we questioning that his ability of giving a first aid at the last moment? I mean, just saving his life and all those things? No, because first aid can be given by anyone who is certified ALS, BLS, and all those things and all. So then comes the sport and its specific things. So what is the, sometimes I sit back and ponder upon things, that what exactly I'll be doing if I'm accompanying the team, and what exactly the team might be missing if I'm not accompanying the team. Because there are certain instances when the teams are not permitted to have a doctor. I mean, not at a multi-sport event such like Olympics, but certain tournaments, some invitational tournaments where we have a limitation of people being there. I was lucky that I was traveling at most of the even the invitational tournaments. I have not missed. So some 30-40 tournaments I have been there in past 5 years with major events. But how many of us can be so lucky to that extent to go with this invitational tournaments? And then the question comes that, are the teams not performing there? Are the teams not being handled at that time by the people present in the team, like the coaches and all? The question is also about the requirement of a sports person. The harsh reality that I faced, not exactly I faced, but I witnessed it. That would be right word, that I witnessed. A physiotherapist was preferred in a position over a doctor. Again, that's not with me, which is happening, but I witnessed it with my eyes, and I was shocked that why. I mean, why the federation and why the SAI is all choosing physiotherapist over a doctor? Because I got a answer in that case that a physio can be of very help from stretching to cool down to all those physiotherapy, last moment rehabilitation and recovery purpose, which doctor साहब आप नहीं कर सकते, because you will not get to that level, and you will not help me out in that thing. I'll feel more comfortable with a physio. And again, I'm saying the some of the people have the people pleasing behavior, and as the effect of that, this can happen. So it's just to think about that such things can happen. Again, the recently sports scientists are filling up the spot because performance is the key. So with performance being more discussed, we are more focused to increase the performance, and the other domains of sports sciences, which are performance oriented, are being more brought into light of the day, and receiving more attention these days, with more investments being done from the government and the other NGOs and sporting bodies to support the athletes, and athletes enjoying and reaping the benefits of it. But that has again created a competition, and when the things are limited, when the resources are limited, when you have only certain limited people to go into the tournament with the team, that particular spot may be passed on to a sports scientist, and that can be a harsh reality. Some of the physiotherapists are also gaining the qualification of masters in sports sciences from foreign universities and all, and they call themselves the sports medicine experts, because the sports medicine is a broader term, and then the nomenclature and everything is at a stake. And our governments are liable to take forced decisions based on the athlete's recommendation and their coach's recommendation to fill up those spots for pleasing the athletes just before a mega event. like give them whatever they want, because if you don't give them, they will blame the government for not giving them the support. That's the common statement, which I think has not changed over past 20 years. I mean, I don't know about the other views of the panelists, but that's what I feel. Again, one important thing that I feel is we lack sport-specific research, and seriously, we need to do a lot as sports medicine experts here, because evidence-based practice is the only tool that will save us as sports medicine experts. Otherwise, we'll be endangered species, because our job will be done by any Tom, Dick, Harry who wants to come into the team and just want to play that job for 2 days and go with the team. So my question to all, and it's a topic of discussion. We really need to think about the possible solutions that we can include in our practicing career to save ourselves, and to call us as experts in sports medicine and practice sports medicine to make a difference to the community, to the sporting nation, to the sporting community and the sports persons, in terms of performance enhancement, in terms of injury prevention and rehabilitation, and the overall well-being of an athlete. And for that, I feel we seriously need to consider about the sport-specific research. The question is, are we ready for the change? And I'm sure the younger generation will say yes, and we are seeing changes with the as the time is passing by. Past decade has seen significant change in sports medicine, and I think past 3 years have been a significant change in terms of the number of publications that are our fellow people at ISSEM have been taking up efforts to publish at different journals and all, and I think the scenario will change in coming future, but that has to be honestly addressed. So the other question that comes to my mind is, how honest can you be in the circumstances that most of the young doctors with the teams at present day who are working with the federation or on the payroll of these federations, where the remuneration is being given from SAI, but the recommendation comes from the federation. So how can your judgments not be influenced by these stakeholders, because your federation is your payroll? I mean, you're on the payroll of a federation. So when the decision comes up, when you have to take a decision in terms of a medical decision that will hamper a person's playing capacity in a team, because I have faced things at certain times, and I was very strict with my decision that I will go with this decision, whatever you want. If you want, you can fire me. So my attitude was like that, and it had put me a lot of times into problems. I was lucky that I was guided by most of the seniors. Some of the seniors who are there with us in this panel also working in Delhi and all. So I used to get suggestions from them, and that actually saved me a lot. But really speaking, you cannot go against your employer, and that times you might compromise your judgment, and that will have an effect on your commitment towards the community of sports as a sports physician. The future problem that I foresee, because of a lot of pathis which are coming into the picture, is of unemployment in near future, because a lot of people who are working with the federations are at the mercy of continuation of their tenure with the with the whims and fancies of the federation. They may hire a sports medicine, and you must have seen that in recently SAI must have hired a lot of people at the designation of sports medicine who are not as per MCI designated into sports medicine category. And ISSEM have always been vocal and is doing something in that direction. But nevertheless, if that being hired and if this problem grows up, what will be our solution? And we need to discuss it today, because we cannot discuss some 20 years later when the problem will be at a peak, because this is the time, this is the transition that we are looking at. And this problem with a lot of seats are opening up into MD sports medicine across India, and I'm sure in next 5 years we'll have almost 100 seats in the country, more than that. That should be there, because that will be the requirement. But can all these people translate into job opportunities? Because when I look at my seniors and all, they all had their permanent jobs into forces, armed forces, police, and all those places. So they were secured. They had just to come on the team as a deputation basis. So wherever they said they were the permanent employees. So they didn't had a fear of going against any of the federations or any of the places in terms of judgment. But when I looked at myself, when I was on the payroll of a federation or a SAI, I had to think twice when I had to take such decision. And this is something which I want to bring it to you for discussion and all. So experience is the biggest teacher. Not taking much time, just on the verge of conclusion. That doesn't mean that you should wait for the first-hand experiences. You can always learn from the experiences of others. And I'm sure that all our viewers must have had some experiences, wonderful experiences shared by great seniors who from the start of the day today, and they will be teaching lessons for all of us. What I learned, from all this short experience of my career of past 5 years working with the teams, that stick to the work you are hired for. Try to be honest in your opinion. Avoid getting into controversies and with the active team politics. And the last and most important thing, I was told this by one of the 4G senior, that you are not hired for resolving all the issues of the team. So let it go sometimes. You should not fall into all the crap that is there in the team. And do what you are hired for. You are not supposed to be resolving all the issues. That will save yourself from a lot of mental trouble to yourself, because honestly, when we work with a team, we are so much attached with the team that sometimes you forget things, and things can get messy in your personal life also. So those have to be balanced. You and uh, uh, the seniors in past lectures have told that you have to balance everything: your personal life, your family life, your professional life, everything. So I think that is the biggest experience that will teach you. Yeah, this is something, a picture post training, that recovery is essential for all. You should have a good session for yourself, a coffee or nice something. This is something which I could have been here in Tokyo had I not left the team. But nevertheless, 2021 had something different in my career, a twist, I would say, and I'm happy about it. That some new things are happening in my life. Exploring the other options in the sports medicine career. So working with one of the institute delivering sports science education programs. I'm the convener of Global Soccer Conclave, and I'm sure I'm inviting you all to be there for, this is an old thing. I'm just sorry, because of the COVID, we postponed it. It is from 5th to 7th of September this time. So we'll be discussing about soccer in great details from all the 5 continents, 100+ speakers, and a great knowledge networking program. The athlete injury management system was again a changer in my life. I was very much waiting for it, that it has to be done. Our athletes deserve the best, something that keeps you burning from within inside, and that when it translates, you get the joy that yes, something we have been able to contribute to the society. I hope it does serve the purpose that it is destined to or designed for. And the last the initiative that we are coming up with for discussing holistic health, the Suswastha, which I'm sure I'll be sending invites to all of you as colleagues to join with me for spreading the community awareness. Thank you everyone for listening patiently, and if you have any questions, I'm always there to answer the best that I can.
Thank you, Dr. Raman. Your views and memories on this subject. We have a few queries.
Yeah.
So we will quickly take 2 questions from the list. One is from Dr. Amar. He asks, in what aspects is traveling with a female team different from that of a male team? What additional consideration should be made as a team doctor?
Well, that is, females do have some problems, which we commonly highlight that yes, they may have some problem with the menstrual things and all, and you have to take care about their delaying their periods and all those medications and all that has to be carried with you, or some anti-inflammatories and pain meds like mefenamic acid and all those have to be there with you. But personally, in my opinion, I didn't feel any difference that a very significant difference when I was traveling with the men and women team, because female athletes, when you work at the elite level, they are more understanding, they are adjusted to that, needs, and those things are almost set in the training itself. So there is nothing, last moment thing which is coming up in when you're traveling with the women team. I mean, there can be some instances where you might have a requirement, and the biggest thing is a male doctor and a female team with the absence of female, nurse or somebody around you. So in that aspect, what I used to have is always examine the female athlete in presence of another female athlete, better a female coach, which is there with the team. And if that is not a liberty, like now in Olympic Games, you don't have a female coach with the Indian team. I mean, with the boxing team. So then borrow somebody female coach from different sport or something which is available there, just to save yourself. And that is the common practice we all do. I mean, examining a female in presence of a female. That's the only challenge that you have, and you can resolve it within the team itself.
One more question from Dr. Barun. As a team doctor, what is the role you play in the times of COVID now, especially while traveling with the team?
It's a very difficult question to answer, and I'm still figuring out what I missed or what I didn't consider when I was with the team regarding the COVID practice. But ensuring the bio bubble and the integrity of the bio bubble is a Herculean task which team physician is entrusted with, and it's not that simple to handle elite team and players and the coaches when you are staying inside a campus bounded by certain laws that you cannot go outside. People find ways to go outside by I mean, this is something which is off the records, practical points. People try to break the barriers, and the rules are in place, but people try to break those rules. And when things get messier, when somebody is found COVID positive in that case, isolating the other people and establishing the contacts and trying to save people from that. I'll give you an instance. It's a big deal or a task. I'll give you an example that we were recently in Spain, and one of our boxer was tested positive. Now he had three people three boxers in that room, and when I was intimated as a team doctor that somebody XYZ is COVID positive in your team, and we are trying to trace his contact. My previous experiences and some of the suggestions from the seniors and everything that we had discussed, I think that gave me a good advantage. So that the first thing I did was inform the coach. Obviously, that has to be done. But more importantly, I just check into the hotel registration that exactly what is the registration counter says, who all are the roommates of that person, because it might happen that people might have swapped the rooms and the official record might be different, and we might when we are giving the first contacts, XYZ may be paired with ABC, and in the end it might be MNO. So that will put you the entire team into the primary contact or the secondary contact thing, and your entire team may be debarred. So situation was like that, and luckily, because of the experience only, I was that clicked in my mind. I checked the hotel register and all, and I got to know that okay, these three people are there with the teams, and the scenario was different. So what we did was, I mean, this is something as a team physician, you have to take calls and you have to do, the tougher decisions along with the chief coach and all. So we had to isolate three people who were the primary contacts, three people who were the secondary contacts, and we were supposed to leave the next day, and the finals were due. And the agreement was very simple. All the contacts, primary or secondary, will not play in the bouts. So we were losing almost 6 bouts that day, and to save that, there was something to be worked out strategically, and we finally worked out a solution whereby we gave up 3 bouts as a walkover and tried to save 3 people and bring out those people with us back to India. Ultimately, with a lot of negotiations and with a lot of efforts by placing the timeline things, and I was just stressing the records and everything has to be updated each day, and every day has to be there with you. So these things actually helped us to establish a timeline that this person was not in contact with this particular person for so and so time, and we were able to rescue other 2 also. So bearing one person, we all came back to India. Upon arriving in India, the scene was different. Somebody of us, I mean, we had a couple of people positive for COVID. That's again a different task. But I think you have to work out in solution. You have to think in terms of administration. You have to think in terms of team physician. You have to think in terms of safety for other people for not mingling up those COVID positive contacts. And I think that's something which is an individual decision and art, I think, would be saying. I don't know what to call it, but I'm sure our seniors who are there with us will shed more light on this question, and they can share more information so that even I can benefit from it. I don't know where. I mean, the decisions are always analyzed retrospectively, whether you did a right or wrong. But I mean, if it's a bad decision, I think it gives you a good lesson. If it's something good, I think you will remember it for your life. That okay, something saved you, and you will work on that line. So that's all from my end on this topic.
For a wonderful talk again. It was more of your personal experiences, which we all could learn from all those pointers that you have given. Moving ahead with the webinar, so I think, as we know, every good event has to end. So to end it remarkably, we have our General Secretary of the Society with us, Dr. Siddharth Unithan, to address the gathering. Dr. Siddharth Unithan did his MD Sports Medicine and is a gold medalist from Sri Ramchandra Medical College. He is the first MD Sports Medicine from the state of Kerala, and he is the General Secretary of the Society. He's been sports medicine doctor for multiple sports associations in Kerala, and he was the Chief Venue Medical Officer for Cochin during the 2017 FIFA Under-17 World Cup. Currently, he is the Chief Medical Director of Sanjeevani Life Care Village, which is an upcoming sports and wellness center in Kerala. Welcome you to give your closing remarks for this webinar, sir.
Thank you. Thank you, Guru. You can hear me?
Yes, sir. Please
yeah. So I have the fortunate as well as the unfortunate person to, to end the webinar session. First, I would like to thank the moderator, because without somebody who can moderate the whole event, the webinar cannot be called successful. So I have to thank Wing Commander Dr. Chandrasekhar Guru, because he has taken a lot of pain in creating introductions for all our guests and for introducing each and every speaker. So I would like to thank again Dr. Chandrasekhar Guru for being the moderator for such sessions, and hopefully for many more webinars to come. Now I would like to thank Mr. Raman Vijayan. He was our chief guest and professional footballer who had come and given his experience and his importance of sports medicine and sports science during his times, and what is missing. He also gave solutions of moving forward, of how to move forward with sports medicine and what can be done better. Next, coming to our president, Dr. Hanjabam Barun Sharma. I thank him for attending this event. He's a busy person and giving his valuable advice for the event. Coming to our speakers now, Dr. Rajiv Ahuja, I don't have to say much about him. He's one of our most senior, most experienced doctors out there, and one of our gurus, you can say. I thank him for sharing his experience on the different competitions and his valuable experience during camps, and his opinions on the role of sports medicine doctors. So I thank you, sir, all the way from Australia. You have taken your time for us and for all the participants out there. Coming to Dr. Kenjom, I don't think any of our members have to, we have to explain about Dr. Kenjom. He's one of our most loved, senior most doctors out there. If any doubts or any queries come, first thing, I always say that ask Dr. Kenjom. He's in Delhi, he can help you out. So he's always there to help everyone out there. One of the most helpful doctors out there. I would like to thank him for giving all the importance of sharing the nitty-gritty details, which is missing usually. We always tell all the big things, the whole wide scenarios, but we miss out the nitty-gritty details, and that is what he has given more important, and the importance of having passion in sports, which is the most important thing, and that is why we all are standing here. Even I think few of us might have skipped lunch also just to listen to this session. And importance of being ready for the challenges of traveling with the sport. Coming to Dr. Rajesh Adhau, sir, He's one of our most senior sports medicine physicians and military physicians also, you can say. Everybody has deep respect for our Kargil hero here. He shared his detailed experience with different teams, and he gave the importance of moral boosting, which is something which is missing and which we have to do on a daily basis with our different athletes. And we should act as sports psychologists to our team so that we know how to boost them so that they can take part. I would like to come to now Colonel Dr. Anup Krishnan. He is one of our most senior sports medicine doctors, members out there, and one of our first few members who immediately, when we mentioned our organization, who jumped in to join and said that I'm there always with you. So any conference, any webinars, we always call Dr. Anup Krishnan because he's always ready for us. So we don't even have to tell the time, he's ready. So I thank him for speaking on traveling with the team. He gave very specific and one of the most detailed talks on traveling with team. It is not very easy to just put a seminar and speak on traveling with teams, but he has made it very simple for an athlete. And if you just look at the slides, which I'm sure is going to be there in our YouTube, if you follow his talk, I think that itself is like one essay question which you can write for all the PG students who are attending the question. This thing. Coming to Dr. Gagan Kumar Banodhe, our treasurer, he is a very experienced doctor and one of our close friends who have spoken in this webinar. I thank him for speaking on what it means to be in a boxing team because usually we hear lots of theories, we hear a lot of scenarios. He gave a lot of examples as to what he did and how it is being done, and that is what is missing usually. He gave also an importance of research and improvement of performance with data and scientific evidence. So that is usually missing quite a lot. Usually we don't think about data and scientific evidence and how to improve our athletes using those. So I thank him for giving such a detailed talk on that. Coming to Dr. Amal Patel, I don't have to say much about him. He is been with us from day one onwards for ISCM, and he has helped us quite a lot. And any talks, I always say that call Dr. Amol first. He will always be there. So he's always ready for us, no question asked. So I thank him for speaking on sports physicians' bird's eye view, his experience through his career and imparting his knowledge to the younger generation. Now, one of the big things always, he is a very straightforward person, and he, as usual, has brought up the different problems facing our sports medicine doctors, which we need to handle as an organization, because that is what our organization is for handling such issues. Because if we do not handle it, then who will handle it? So I thank him for that and bringing up such issues so that we can discuss it in different forums as well as in our group WhatsApp groups, so that we can put on forward steps as to what can be done, and that is what we are planning to do in the forward days. I would like to thank our participants. We had quite a good number of participants in YouTube as well as those who had registered and watched this whole webinar so long. Even though there were lots of Olympic events going on, Mary Com and everything, I understand, and we are very regretful that it was during these events. But unfortunately, we have to do such events. Otherwise, there is no time. We cannot waste such time. So I would like to thank all of them for attending. I would also like to thank all our international participants, because we had participants from Sri Lanka, we had participants from Malaysia, so we had a lot of international participants also. So I would like to thank them for attending, and unless you have participants, there is no webinar, so you have to thank them. And I would like to thank the two most important people here right now, Dr. Deepak and Dr. Ashay, because without them, this webinar won't have happened at all. Dr. Ashay was the one who put in the idea to say that we will start a webinar. Why don't we push in? And he took up all the efforts for getting all the speakers, interacting with all the speakers, pushing all the emails. So I have to thank him, because without him, none of this would have happened. And Dr. Deepak, he took all the efforts to, call everybody individually, check whether the videos are working, all the IT work, which is not an easy thing to do. So I would like to thank all of them. And I would like to thank again all the speakers for taking their valuable time to impart such knowledge to our new generation, coming up generations. And hopefully we will be doing so much more webinars like these, so that we bring it up much more and it will be much more interesting. I would like to thank once again for giving me this opportunity to giving the closing statement. So thank you. Back to you, Guru.
Thank you so much, sir. Thank you. And I could see one of our senior most sports physician here joining us, Dr. Kiran Kulkarni here. Sir, can you hear me? Few words from you, sir, so we can wind up the session for the day.
Thank you. Yeah, actually, since morning, right, dot 10:30, I'm there in. I have not been to all the speakers, and it has been a fantastic event. Congratulations! And actually, I have no words to say. Right from traveling with teams, getting selected, actual problem of being with the team, the administrative problem, dealing with federations, dealing with administration, dealing with media, everything has been spoken about. And definitely, yes, being a sports traveling, like as I think I was those doctors who got a very early breakthroughs. I was with managed gymnastics right from my second year post graduation in Patiala. I got an opportunity with India gymnastic team at the SAF Games. So from there on, it went on, and the most important 2 points I would like to put forth here is, at least I think we are about 150 to 200 sports medicine, MCI, National Medical NMC qualified sports medicine doctors in India. So at least about 100 plus of them are in the forces or unemployed. So what about the remaining 100 people, 100 sports medicine doctors who are actually in the fray of being into the private practice? So even this has to be like maybe one of the talks where like even a senior sports medicine doctors can guide us probably in the next coming session, because how many of us are ready to travel with the teams? There are so many problems, you need to set up your private practice. If you are in forces or if you are already employed, there's no problem. But at least half of us who are not employed or who are not into the working for some organization, and totally one of the doctors like me myself, right from day one we have been working in the private sectors right from day one. So we all know that we are in between, making ourselves a space in this doctors of all the subspecialties, or what we call it as a medical specialty. So how to start off? What are the areas in which we can tap so that we make a very good standing in the society? Okay, so this is one of the aspects which I actually want to tell, and nothing beyond this, because traveling with men and women gymnastics, traveling with women hockey, yeah. I definitely traveled to South Africa, Chile, and Argentina with the national women hockey team. So we had actually certain challenging things when it came to dealing with women players. When I was the only medical personnel who traveled with the team along with coaches, manager, and a trainer. So there was, as Dr. Ahuja said, that he was a massager, he was a biomechanist, he was a physiotherapist. It was the same. Because almost it was a 6 weeks too. I also happened to be, and as a sports medicine doctor and a male doctor, each doctor should know where the line ends. So that is being professional, or ethics of medicine, or being the professional. So if at all we do not know where the line ends, probably that would be the last day of any of the doctors practicing. So these are the few things which I wanted to share with you people, but excellent, and I think the whole 8 hours have been outstanding, and it's like hitting multiple nails in the coffin so that we all improve. And thank you for giving me an opportunity. Thank you, one and all. All the best.
Thank you so much, sir. Thanks for having me. So I think I would like to thank each and every one of you to have shown so much interest and lend a patient hearing on this Sunday afternoon. Signing off from you all, Until next time soon, we meet in another interesting webinar organized by us. Thank you, one and all.